สวัสดีค่ะก็ตอนนี้เราอยู่กันที่ Facebook Live นะคะของช่องของคณะสถาปัตยกรรมศิลปะและการออกแบบวันนี้ถือว่าเป็นโอกาสที่พิเศษมากๆอีกครั้งหนึ่งนะคะที่เราได้จัดสัมมนาข้ามทวีปนะคะก็คือสัมมนาระดับนานาชาตินะคะชื่อหัวข้อก็คือ Fit Cities Fit Towns ซึ่งเป็นครั้งแรกเลยนะคะที่เราได้ร่วมมือกับUniversity of Alberta นะคะชื่อว่าDepartment of Medicine เนี่ยนะคะที่จะจัดสัมมนาในหัวข้อที่เกี่ยวข้องนะคะของ2เรื่องนะคะที่อยู่กันคนละสาขาเลยนะคะอันแรกก็คือเกี่ยวกับเรื่อง Urban Design หรือทางด้านสภาพแวดล้อมทางกายภาพแล้วลิงก์กันนะคะกับสภาพแวดล้อมที่มองมาจากมุมของสาธารณสุขหรือทางการแพทย์นั่นเองนะคะซึ่งในวันนี้เนี่ยเรามีแขกรับเชิญมากมายเลยค่ะแต่ว่าเดี๋ยวการพูดคุยการเสวนาทั้งหมดในวันนี้นะคะจะเป็นภาษาอังกฤษทั้งหมดนะคะใครที่สนใจอยากจะชมย้อนหลังก็สามารถมาชมได้นะคะทาง Facebook Live ของคณะสถาปัตย์ชื่อว่า School of Architecture Art and Design นะคะในช่วงต้นนี้เดี๋ยวขออนุญาตเริ่มเปิดเลยแล้วกันนะคะว่าในวันนี้จะมีใครกันมาบ้างนะคะเอาละค่ะในภาพที่เห็นตอนนี้นะคะก็จะมีวิทยากรนะคะทั้งหมดที่เราเชิญมานอกจากตัวดิฉันเองผู้ช่วยศาสตราจารย์ดร.อันธิกาสวัสดิ์ศรีคณบดีคณะสถาปัตยกรรมศิลปะและการออกแบบของพระจอมเกล้าลาดกระบังแล้วนะคะเรายังมีอีก5 ท่านด้วยกันที่เป็นวิทยากรพิเศษงั้นขออนุญาตใช้ภาษาอังกฤษเลยนะคะ Hello, good morning for the Northern America, good afternoon for the European region, and good evening for the GMT time. So today I'm really happy to have this very special occasion to run the international seminar on the through the virtual conference like this. The title of today is the Fit Cities, Fit Town Thailand 2022. And this is a special, as I say, because it's not only one discipline that's gonna talk about the space design, environmental concerning about health, healthcare and well-being. The talk will do across disciplines on the common goal on the livable city and health and well-being. This is an international webinar for sharing perspective on the interplay between the built environment and health and well-being in the city development across borders. This is the first conference that share evidence-based strategies and practice inform innovation for improving our buildings, neighborhoods, inclusive urban life, street and community for healthy living, including active transportation and active recreation. And you can join us on the Facebook Live called the School of Architecture, Art and Design, KMITL, which is the university in Thailand that has the School of Architecture, Art and Design. I'm not alone here. I come with other very special very special speaker today. I would like to introduce all of the speakers today. Hello, everyone now in the Zoom with us. Can you please turn on your camera? So it's time to say hi and greeting our audience now across the world from both in Bangkok, Thailand, and around in this region. And I hope that we can enjoy the morning, afternoon, and evening session for you today. Firstly, let me introduce Professor Anand Srikiat Kajon, the Dean of the Faculty of Medicine, KMITL from Thailand. Hi. Next, Associate Professor Dr. Karen Lee, MD. She is the from Division of Preventive Medicine, Department of Medicine, University of Alberta, Canada. Hi, hello, Kellen, good morning. Okay, next, Mr. Jeffrey Shoemaker, AICP. We will find out next what is that stand for. He is the founder and president, Urbanscape, and former chief urban designer at New York City, USA. Good morning, Jeffrey. Very nice to have you here. And next very special speaker as well, Rola Kerr from FAIA, lead AP president. Good morning. And the last but not least, Wendy Fewer. She is the former assistant commissioner, urban design, art, and wayfinding from the New York City Department of Transportation. Good morning, Wendy.
Good morning.
Okay, so thank you so much for joining us today. And I will show you a bit about what next in our 4 or 5 hours from now. Okay, so let me start with my session. I am the Dean of the School of Architecture, Art and Design. We have different disciplines that share common ground on creativity. We have urban planning, we have urban design, we have the architecture and interior architecture. We do communication design, fine art, and industrial design. I would like to share this perspective from design and research on the challenge of inclusive design and livable city for everyone, a case of Bangkok City. Okay, at the school, we have the Inclusive Design Environment and Research Unit, Core Idea Unit. In this unit, we focus on the people in the wider spectrum from like people who has the limitation of movement, like we call the disabled people, from a wide range, from mental illness, to blind, to the physical mobility disabilities. And I also encourage, people to aware of important of the role of the built environment in wider range, either domestic and international. Okay. From in Thailand, we also digest what called like the research or maybe academic perspective into the very easy to access, like writing on the magazine, for example. Okay, and I also share my perspective through the public as well, like the TEDx. Is this a talk that can share experience and perspective on different disciplines? I also emphasize on the important when people start to concern about how the city can deliver quality of life of the urban people via the smart city concept. Also, we do have the service center, academic service center, to provide the knowledge from design discipline to the government to recreate or improve the quality of accessibility, particularly in the public transportation. And we also run a project with the government. This is a government fund project to develop the waterfront along the waterfront in the river of Thailand called Chao Phraya project. This one, we won the prize in 2017 because we run through the design through the community's participations. And by doing that, we can add, the concern to people with different ability to access to the waterfront. In the classroom, not only for the research and service or teaching, we also use the user-centered approach in teaching and learning about inclusive design. When we adopt the empathy approach to the learner to mock up their experience when they have experience like blind people or even the wheelchair user people. And we transfer that kind of knowledge to the public as much as we can. Like this, like the public exhibition to transfer our knowledge to be easy to access. Like, what if we design the bus stop for wheelchair user? For the bigger picture about livable city, before we can get into the case in Bangkok City, I think this is very important because I think all around the world, particularly in the education. Okay, sorry, I will jump a bit from the first, that talking about my research center, and then we like to transfer our knowledge to the different channels as much as we can, like to the newsletter, to the magazine. Like we want to digest what called the academic, knowledge to other people in the public. And for some talk, I have opportunity for the TEDx to share the worldview about experience what people expect from the urban life via the smart city concept. And through our design service center, we deliver the design to improve the public transport for the government. And in the recent year, we won the prize to improve the waterfront in the Bangkok City River called Chao Phraya. By doing that, we include wide range of people who use the public place. For example, people with disability, older people, mother with the card for their kids. So we won the prize in terms of we do this big project via the participatory approach. And in the classroom, we also adopt the user-centered approach by, give them the learner the experience like they were wheelchair user or blind person. And this is important because this is the way that the architect to be can understand their user from inside. And also we adopt like empathy approach so that people who are the learner can understand from, real experience. They can be the first-hand experience as a blind or wheelchair user. And after that, we always transfer our knowledge to be easy to access for the public. Okay, in terms of the livable city, I think sooner or later, not only for education industry, but for all of us, like company or the communities, will be forced to understand more or less about the goal of the Sustainable Development Goal. And for the school who run about the built environment, the goal 11 is very important because we see the quality of life through the improvement and development of the physical environment as well. I might not go into deeply about each factor to create the city livable, but I like to share maybe the key components for people who try to develop the city to be more livable. For example, low crime rate, strong economy, accessible quality healthcare, good school, transportation, natural and cultural amenities, affordable housing. You can see here, we can see that there is a very important role of the discipline about architecture, design, and even art for some aspect. but we cannot work alone. So I like to share the way that we try to drive or to move the improve the better quality of city life. Some recent years, we learned that in Singapore, the city for the small country, they have far developed from, like the underdeveloped city, like in the past almost 60 years ago, but they can very fast develop to be the first world country, in just 1 or 2 generations, which means we need to learn from the best practice. We went to Singapore University of Technology and Design to set a course, according to their perspective through their government, use the design thinking into teaching and learning about architecture then. And we found that toward the livable city, there are a lot of key components that we cannot ignore. And we took all those into our teaching and learning at the School of Architecture in Thailand. And then I have opportunity to learn from other perspective, but share the common ground on the design thinking to create space for all. You can see here in this workshop, try to create the public space, and then from the people who come from different disciplines, for example, from designer, architects, urban planner, and even if some from they are economists or some artists, they might not share the common discipline, which is very rich information when we want to create the common public space that can include everyone. Here is some experience from the workshop in Oslo, Norway, some years ago. They also use the empathy approach if they think about the wider spectrum of the user in the public places, like people who have difficulty to move in a wheelchair or use the crutch, or using some kind of art or creativity to create the public place. I think when they concern about more people who have very differences by empathize them what they really want, like how older people explore a little journey in the city, what they want, not only the smooth pavement, but also some people who use wheel to travel, not only for disabled people, so everyone can flourish in the city and enjoy. Okay, some other interesting case, I learned that from Japan as well. When the revenue system, they pay back the tax as the local and central government, they separate the return of the tax for local government and the central governments, which means that the local community, they can have their own budget to improve the quality of, for example, in this picture, for their pavement. When the pavement is very friendly for all kind of user, particular for older people who has difficult to move, they can use their pension or their welfare, some kind of money to spend during the daytime, which means they can return the VAT or some kind of money back to the government as well. And also, if you see in this picture, the shop house along the footpath, when the elderly, they can use the space by their own independently throughout the day, it can generate also the economic, while it is quite different from some part in Bangkok, when people mostly use the car or ride their bicycle, the shop house, found a lot of disadvantage, people not walk to buy things. So I think this social inclusion can generate equal economic opportunity as well. So the challenge in Bangkok City, I like to share this for some of my research, some more than 10 years ago, but still the footpath in the Bangkok, like inner city, like a CBD, in some places, they still cannot safe to use. There's some violate to the law, or some kind of design feature already made according to the international standard, but the people and the way that they use the public features is not get along with that kind of standard as well. So to a certain extent, it's very dangerous for people who use the pedestrian. So I summarize in this like experience in the public place in Thailand, in the case of disabled people, when they want to negotiate with the public realm and what they have to face with the some kind of feature disappear, not support their life, or some kind of feature already there, but people violate to the law. So I think it's a kind of a circle when people have a certain perception about a disabled people. The disabled people, either the group or individual, they try to embodiment themselves into the public place. I think this is very important. So I want to emphasize here, if the space in the public place can support or accommodate disabled people so that they can go out and about, they are someone in the public place so that people can aware their existence. So I think the role of built environment is very much important, not only for people who are strong or healthy. In this case, in my research, we found that when disabled people, they get together as a group and they can link themselves with the industry. In this case, there are some construction industry interest to join with the campaign to create accessibility for disabled people. And then they have the media, like the newspaper at that time. So their voice is very stronger, get stronger. So the government and or the state agency, they quickly, remove the barrier, as you see in this picture. But some place might not work well. Like I compare this to picture like 14 years difference about the curb in the public walkway. There is no ramp or slope for to be accessed by the wheelchair user on your left hand side. But 14 years later, when I would like to call this kind of the model that disabled people, they get together and they emphasize their voice, or they voice out through the media, and the state or the government agency start to aware. And also if the industry, like the private companies, join in, I think it's very strong model to change or to remove the barrier, particularly in the city. As you can see here, I summarize, if we want to do some kind of movement that make the city can be accommodate to everyone, particular for people who are the most vulnerable in the city is people with disabilities. We need knowledge, network, and it depends on the political environment at that time. The knowledge can come from the media, or even if the embodiment of the people with disability themselves in the public place, so that when people see and they're aware and they believe that the environment can, make people able or disabled. So the quadruple helix model is important in terms of mobilizing. If you want to make the cause stronger, the government, they have very strong in terms of the regulation, the rule or the law. The society, they can raise the issue, they can strengthen the voice of the vulnerable. And academic research, like our part in education, we provide the knowledge, we can share and exchange from the best practice. And the business, they have money. And also they can force the government, because in Thailand, the majority of the land owned by the private sectors as well. So I like to summarize here. We need the mechanism that can, strengthen the voice of the vulnerable if they want to be in the city equally and inclusivity. Thank you very much. I'm really sorry for the beginning. I forgot to share my screen. And for the next session, we will follow this schedule. I would like to introduce Dr. Anand Sikierkajon. He will talk on the public health service has been transformed in urbanized community after pandemic. For sure, we can have his perspective on the healthcare. I would like to introduce a bit about Dr. Anand Sikierkajon. He received his MD from Faculty of Medicine, Sirirat Hospital, Mahidol University, and Board of Neurology from Faculty of Medicine, Chulalongkorn University. He worked a research fellow at Institute of Neurological Science, University of New South Wales, Sydney, Australia. His area of research is biology of headache. He has published more than 70 research papers and 5 chapters. He received many awards, including Wolf's Lecture Award from the American Headache Society. His current position is Professor of Neuroscience and Dean of the Faculty of Medicine, King Mongkut Institute of Technology, Lat Krabang, or KMITL. In addition to his neuroscience research, Professor Sikierkajon is also interested in architecture and has involved in several design projects such as university library, medical clinic, hospital, etc. So please, Dr. Anand, if you're ready, the floor is yours.
Thank you very much for your kind introductions. Allow me to share the screen. Okay, you see my screen, right?
Yes, please.
Okay, Art, and thank you very much for inviting me. It's so exciting to share the panel with people outside medicine. Okay, so the topics that I would like to talk today is about the pandemics, and as you know, we are during the pandemics of the COVID. And the title that I use for today is the living with pandemic when abnormal become a normal. We are now in the pandemics and of the COVID-19, and you know that it affects more than like 500 million people worldwide. And Thailand actually was the first country to report the first case outside China, and it happened in January 13. 2020, and the initial wave of infection was related to the nightlife venues and the boxing match in Bangkok, and its peak on the 22nd of March. And at the times we were very, very excited, and because we believe that it is like a deadly virus and it would cause a lot of burden to the Thai community. So Thailand acts very rapidly to that first wave, and we use both the social measures and the public health measures. And the social measure that we are talking about the government at that time tried to minimize the droplet transmission measures. So they declared a state of emergency and this stay-home policy for the whole months of the April, cancel all national holidays to prevent the gathering, school closures, blocking all international flight, and this method has been implemented at that time. So we've used the work from home policies, avoid social gathering, avoid touching faces. At that time, we did not implement the mandate face coverage yet. We try to foster the physical distancing and enhance sanitations. And this is a study, and you can see here that this is the measures that implement at the time, and you can see that actually Thai people follow the recommendation quite well. You can see that almost like 90% wear masks, face masks, and wash hands around 75%. And you can see that, and this is the trends of the infected case, and you can see that it goes down quite rapidly during the first wave. And this is the tracking using the Google mobility data, and you can see that a lot of people try to stay home, and you can see that the number of people at transit station are dropped enormously during that period, and that implemented along with the public health measures. During the first attack, we implement the thing that calls it. We try to identify the index case, try to quarantine them and monitor all those who close contact with the index case. And we got all of the positive cases in the hospitals and isolated for quarantine for those who close contact with the index case at least for 14 days to prevent the further transmissions. And this is the programs, the pathway that they use at that moment. So we have a confirmed case here, and those, especially for those who are at the pass the border, since we are close to Myanmar, and a lot of workers from Myanmar move into Thailand for working. And so if they identify the case, they connect it to the provincial health office, report to the regional CDC and to the Ministry of Health, and then they report to the district health office and do the contact tracing. And one of the things that very helpful system in Thailand at that time is that we have the thing that we call the village health volunteers. And what they were doing at that time is that when people get across the province, the village health volunteers will come to visit that house and like cross the bubble, that wrap and bubble that house for like 14th day and prevent the people who cross across the province to travel outside the house. So they seal the house. And with the help of the village health volunteers, the first wave was quite controlled. And this system is the unique features of Thailand, and it's created from 1977. And if you look at it, you can see that most of the village health volunteers are women. Like this one, so mainly it's women that elderly or retired housewives, has the leaderships and respectful persons, and they work as a volunteer service. Like here, Miss Surin Margaret dated, like 77 years old, village health volunteers. That she said that I consider people in the village my family. If I don't educate them, they will not understand the risk of getting infected. So with this nice voluntary network, Thailand can control the first wave, and it was recognized all over the world, like here in the page of the World Health Organizations that mentions about the village health volunteers and call them the unsung heroes. The WHO representative in Thailand visit the health volunteers in the urban, in the rural province. So the first wave is well controlled. And it makes the big like news all over the world, like it appears in the New York Times and about the how Thailand can control the first wave. But anyway, like 6 months later, we experienced the second wave, and the second wave it was quite different from the first wave because now it attacks the peoples in the like large areas of migrant worker communities in nearby the province near Bangkok. It's called Samut Sakhon provinces. So they almost like have to seal that area, try to prevent and try to contain those who infected, and because most of the infected cases they were like healthy, like young adults and workers, so they didn't have much in terms of severity. So at the times, Thailand tried to contain all of that, but the second wave increased the reproductive number, which means that it increased the higher, like more contagious to the first one, because of the most of the migrant workers asymptomatic. This means that they, even though they have virus, they didn't have any symptoms, so they can spread virus without even without knowing that they have virus. They don't use face masks, and their dormitory is very crowded. So the measures at that time is changed from the contact tracing, which try to find the index case and follow and quarantine everybody who get close contact with the index case, to the active case findings. So they send teams out and to try to find the positive case, even though they are asymptomatic, and try to contain all the cases. And this is the report that from Thailand that published in British Medical Journals Global Health about the responding to COVID-19 second wave in Thailand, and they point out the change in the measures. So instead of trying to contain, find the index case now and seals and implement the work from home policy nationwide, which of course it has a strong effects on the economies of Thailand. So during the second wave, now they classify the area with they call it highly restricted zones, the restricted zone and the control zone, and the measures that implement in different zones behave differently. And so they use the techniques called categorizations, the lockdown measures. So they lock down according to the zone, and the policies and the measure are different among the zone. And using the bubble and seals measures, instead of using the RT-PCR for every cases now, because the number of cases is so it's very high, so they use the 5 sample pool saliva test for cost saving, and they can control the second wave, even though it's a bit harder than the first one. And finally, Thailand can control the second wave. And this is the measures of the mobility. And you can see that the response is pretty okay, but it's not as good as in the first wave, that at that time everybody but right afraid of the virus. Now they seems like they start to get used to it. So the lesson learned from the second wave is that the Thailand implement for the public health and social measures are successful, result in successful containment of the COVID-19, sales up capacity of the labs, agile and adaptive response are critical, and the track down target lockdown and active case finding instead of the nationwide lockdown. So we survived the second wave, and then we came with the third wave. And the third wave now it develops in the April a year later, and now they got the alpha variants from the UK, which is more severe. And the patterns of infections in the third wave was different from the second wave. The first and the second wave, they affect the people in the lower socioeconomic class. But now they affects the people in the middle to the high socioeconomics, and it happens in the entertainment areas in Bangkok. It's called Thong Law, and it happened in Bangkok, which is different from the first and the second, which affect more on the outside. So the problem occurred because it developed in Bangkok, and you can see that Bangkok is urbanized, it's very crowded. So the thing that they try to do, for example, like isolations, was not very successful. And Thailand, in Bangkok, they have more than 1,200 Bangkok slums, and the standards of living in that crowded area was not very good. So they cannot contain and they cannot control the virus. So the third wave is a very serious one. And then they send the people to do the nasal swab. They try to do the active case findings. So we have the third wave here, and it seems to be quite contained into some village, the plateaus. But after that, we have the fourth wave, which now is a Delta, and the Delta is more violent. And the number of cases you can see here is the number per day is it's much higher compared to compared to the third wave. So now Thailand face a very big problem because the number of beds in the hospitals in Thailand over the country was not enough. So we have to use other measures. We cannot put instead of trying to put everyone in the hospital, in the real hospital, now they have to do something else. So the first wave with the Delta faces new variants, and so they increase the number of cases as well as increase the number of death rate as well. And the ICUs, the ventilators are fully occupied. So what Thailand did at the time, so they have to turn big areas into like a field hospital. And this is appear in the garden in the UK, the Thailand Bangkok warehouse turned into the 1,800 bed hospital as COVID crisis worsened. And we developed the field hospital, which actually equipped with ICU. But anyway, so the hospitals now the hospital beds were reserved for those who have severe symptoms only. For those who have asymptomatics or mild, have to put them in other places. For example, like we turn the hotel into the hospital just to quarantine it, and we monitor the patients. So a lot of hotels in Bangkok, in Thailand, were turned into the place where we keep those who got infected but not very severe one. And anyway, it still costs a lot of money. So Thailand used another measure called community isolations. So they change the public area, for example, like schools, the temple, and use as a community isolations. We also use the measures like home isolations. So the patients are isolated at homes, and we monitor them. We give them some instruction what they're gonna do. So the home isolation reserved for those who are less than 60 years old, asymptomatics, and have our house that can be very separate and have no other risk factor, for example, like obesity. So the technique that we used at the time is we classify people, those who infected into color, like severe. The most severe one is like we use the red color. We put them in the hospital. They moderate levels, put in the hospital or field hospital, and if they have a severe symptom, we refer them to the real hospitals. And those who have a very mild symptoms or asymptomatic, we put in the communities as well as in the home isolations. But at the times, the government supplies them with the 3 meals a day, thermometer, oximeters, essential machine, and we use the telemedical consultations, and they call the patients up every day to monitor the symptoms. So far we can contain the fourth wave quite okay. So we passed the peak of that, and you can see that like in here, the public health ministry is closing down the field hospital at the exhibition center, the largest the exhibition center in Bangkok, which is called Muang Thong Thani. And you can see that they are host so many beds in there. So we survived the four waves, but it affects the economics like drastically, and more than 20% of the household experience a decline in their incomes, with around 80% of the household in rural areas and low-income experience income declines. And so after the Delta, now we have another one. This is called the fifth wave, and it is the Omicron. And the Omicron is, compared to Delta, is less severe, but it's more contagious. And you can see the numbers rise quite rapidly after just and this is the fourth wave, and you can see that we can contain it, and then come the Omicron. And the Omicron is even though the number of cases is very high, as I said, the number of death rate is much lower compared to the Delta. So the measures that that we use is quite different from Delta. Now the case was too many to the level that we cannot make a diagnosis for everybody. So we cannot put them in the hospital. It costs a lot of money. So this is the confirmed case, and you can see the Omicron here. And actually, the number of cases it shows in the graph, actually it's not a real number, because a lot of cases now did not report to the health system anymore. Okay, so to summarize, you can see that we use, in the very first wave, we use to stop the spreading. We lock down, we do the RT-PCR and identify the index case and quarantine those who related. During the third and the fourth wave, during the time that we're building up the immunities, and we vaccinated at least around 70% of the population. And now with the Omicron, we have another subvariant of Omicron, the BA2.5, 0.5, which is even more contagious. Now we need to use other measures like universal preventions. So we cannot contain those who positive anymore. So the government come up with this recommendation, like the MHTTA. It stands for the distancing, mask wearing, hand washing, temperature check, using the rapid test, for example, like antigen test kit, and the applications. The applications was developed to monitor, to track down the mobilities of the people. And when we start to reopen the business, for example, like a restaurant in Thailand, they come with a system that they call the COVID-free setting. And so the environment should be good ventilation, clean sanitation, and promote physical distancing. For the personnel and the customers, they require the full vaccinations, weekly etiquette testing, sorry for that, and have the screenings and the practice. So if you look at the Omicron, and you can see that this the blue area represent those who positive, and the yellow area is those who positive and stay in Bangkok. And you can see that high majorities, especially for around here, you can see the high majorities of COVID positive cases are actually in urban area like Bangkok. And this graph shows the day that related to the COVID-19, and we can analysis show that there is more the higher death rate, especially for those who have the risk factors. And it showed that around 75% of excess death during the April or October 2020 are directly related to the COVID-19 infections. And the rest 25% are also related, but not directly. For example, because of the hospital beds were fully occupied by the COVID-19, so those who suffer from other cases have no bed, and a lot of like operations and surgery, the operation has to be postponed because of the inavailabilities of the hospital bed, and that also caused the increasing death in Thai people. And this is the risk factors that the Thai government called it 608. This is stand for the over 16 years old of age and have the 7 underlying disease like chronic obstructive lung or cardiovascular, kidney disease, previous stroke, obesity, cancer, or diabetes, and plus 1, which is a pregnancy. So those who have the 608 criteria need to have cross monitors. And now, even though we are in the 5th wave, it's now coming with the 6th wave with the new variants, B8.5, which is more contagious. And it affects more in urban areas. So actually, why the COVID pandemic is manifest as a health emergency, it could be more accurately framed as a planetary health emergency. It's because its ongoing global health on urban growth has been associated with disruptions of the ecological balance and increased risk of exposure to new pathogens and emergence of new disease. So what we learned so far is that COVID is an urban disease. Its impacts include both direct and indirect, and control the pandemics require both social and public health measures. And we need the more convenient and effective healthcare systems that promote the physical distancing. And this is some example that developed during the period of the COVID infections, and we still use it at this moment. For example, like our tracking system that we call Thai Chana. Chana is referred to victory. So it's an online platform to facilitate disease control tracking to the customer. So the shop have to, those who go to the shop have to scan this to check in. And we also use the aerospace engineers technologies to monitor the patients. And so we need to have more effective way, and that also promotes the physical distancing. And I think that the one that to be the answer is about the telehealth. So the telehealth is referred to the system that we monitors the patient using some kinds of remote sensing systems, and we can give the instructions and the prescription via the online platform. For example, like here, as you can see that we can monitor the patient using the webcams, and there are a lot of health technology right now that you can that it will become the mainstay of treatment in the future, because a lot of people now fear to get into a hospital which is very crowded and exposed to the virus. And here are some examples of the virtual hospital platform that used in Thailand at this moment. And in the futures, or in the present in other countries, for example, like in China, they have a booth like this called Ping An Good Doctors, that they can have a chat with with doctors online, and they can and they give the prescription, and they can buy the prescription at the kiosk, and no need for the hospital. And this digital healthcare, which will help in terms of the pandemic, will be a normal practice in the very near future, because it is a smart care. It's more convenient, and the patients can have to get their health service at any times. They empower care. Patients have more engagement in the treatment, and it's cheaper. So I think that the digital healthcare will be an answer, and the pandemic will stay with us for not and I don't think it will subside in the very near futures. And now we come up with other things as well, for example, like monkeypox. So we have to think about how we handle with this, and this is include both the change in the fixity without like in the topics like here, as well as in how the people react with the pandemics. And thank you very much.
Thank you so much, Dr. Anand. And of course, the perspective from the Faculty of Medicine and from the doctor in terms of the how Thailand cope with the, of course, this crisis of the pandemic, and a lot of innovation come afterward. And very impressed by the what he mentioned about the village health volunteers, while we see this as an urban disease. Thank you so much, Ka. Okay, for the next speaker, we are still in the healthcare perspective. We have Dr. Karen Lee with us now. May I use a brief time here to introduce Associate Professor Dr. Karen Lee. She's from Division of Preventive Medicine, Department of Medicine, University of Alberta, and of course, she is the author of the Fifth Cities, the book. And Dr. Karen Lee is now working on many research, and practice as well. She is the author of the book called Fifth Cities, which we will do the book review very soon. Please follow us about the book review of her session as well with the KMITL Central Library. She also teaches courses for other universities, such as the Designing Healthy City course at Columbia University's EPIC Summer Institute each June every year. Currently, she directs the Housings for Health initiative at the University of Alberta, bringing together more than 200 multi-sector partners in Canada to improve housing developments and the neighborhoods around them for health and well-being. Prior to returning to Canada in 2018, Dr. Lee worked for the City of New York's Health Department as its inaugural Healthy Built Environment and Active Design Director, and deputy to the Assistant Commissioner for the Chronic Disease Prevention and Control during the Bloomberg administration. The comprehensive health in all policy work by New York City Health Department in partnership with New York City's many other departments, including Department of City Planning and Transportation and the Majors Office of Long-Term Planning Sustainability, improve New York City buildings, street and neighborhood for health and well-being, and co-benefits such as environmental sustainability and economic revitalizations. The partnership work in New York City achieved many important outcomes, including reversal in childhood obesity trends and improved life expectancies, and won many awards, including the World City Prize, the Sustainable Building Industry Council Grand Prize, the American Institute of Architects Collaborative Achievement Awards, and U.S. Environmental Protection Agency National Smart Growth Achievement Award for overall excellence. In 1917, Dr. Karen Lee was awarded the Canadian Institute of Planner President's Award. And of course, for more information, we can find out about her in the World Wide Web, drkarenlee.com. Okay, I'd like to hand back to you, Karen, for your perspective. Very interesting, because long time we see when we talking about the doctor or some people from the Faculty of Medicine, we thinking about cure, or fight with the disease. But your perspective about prevention, I think is a very value experience that you can share with us today. Okay, so when you're ready, okay, I'd like to hand over to you currently, please.
Thank you so much, Antika. I'm going to share my screen now. Hopefully people can, can you guys see my slides?
You can press on the green button. Share screen share.
That's right. I have to share screen first. Sorry, guys. Share screen. Share. Can you see that now? The slides?
I think, yeah, it's work now. Okay, perfect.
Yeah, you can see it now?
Yeah.
Okay.
So you have 30 minutes. It's yours. Okay, thank you.
Thank you, Antika, for inviting me and the panelists today to share, I think, some of our thoughts with you. Fit Cities, Fit Towns, Thailand, really exciting. I think when we started this work way back in New York City, our Fit City conference was one of the first things that we had done to bring together different sectors in order to improve health and well-being by looking at how we can make our community environments healthier. And I'm really thrilled today that Antika reached out and we had a chance to work together to help organize this conference. And then, I have some of my previous colleagues from New York City here today, Jeff, Lori, and Wendy. And the partnership between different sectors is actually a really important piece. And you'll see this isn't just today, but also in history in terms of how we improve health in many of our countries and cities. So if we look at public health crises, I know we're living in the midst of a COVID pandemic and we're thinking COVID, but actually there's a whole host of other things we need to think about that actually can contribute to how severe our pandemics might be. So, in the past, we had mostly infectious diseases, diseases like cholera, malaria, tuberculosis were really important in the 19th and early 20th centuries. Also, we had high maternal and infant mortalities, safety issues. And as you'll see, one of the ways that we actually got rid of many of these diseases was to think about how we designed our communities, how we planned and constructed our cities and our towns as well. Today, we've got a very different set of diseases. Actually, if you look at what the leading causes of death are, they are diseases like heart disease and strokes, cancers, diabetes, and risk factors like obesity. These are rising rapidly throughout the world. We have aging populations. We've got mental health issues, climate change and environmental pollution. We still have environmental preventable injuries. Many of them now are from motor vehicle related injuries. And then of course, we've got emerging infections like the one we're living in now, COVID-19. I think what's very interesting is that, COVID-19, for example, how severe you get COVID, whether you actually are at risk, at increased risk of dying from COVID, are impacted by these other issues that are priorities for us. So we know, for example, that the elderly and people who are older are at risk of more severe infection and death from COVID. We know that if you have chronic diseases like diabetes or heart disease, or if you are impacted by risk conditions like obesity, that you are also more likely to have severe COVID or to die from COVID. So these issues are actually linked together, and what we do about them need to be linked together. So this just takes us back to some of history in terms of thinking about how did we get diseases in our communities that were rampant under control. So 100 plus years ago. So this is a slide of New York City in the early 1900s, late 1800s. So you could see that the environmental conditions were a breeding ground for the epidemics that we saw then. So lower Manhattan had lots of overcrowding. So in 1910, densities were about 114,000 people per square mile. It's about double the densities today of Manhattan. You also had inadequate systems for garbage, water, sewer. So you have polluted water supplies. The drinking water came from a pond downtown that often had garbage in it or dead animals floating in it. You know, people lived in, for example, the picture shows you tenement buildings, and these tenement buildings don't always had to have windows. They didn't have a lot of regulations around them. Often they were overcrowded. The streets were actually, the buildings were placed very close together so that sunlight couldn't actually enter many of those streets, and they were dark and dank, and they bred mosquitoes because puddles would never dry up. And so the types of diseases that you saw were related to crowding with poor ventilation, like tuberculosis, waterborne diseases like cholera, and mosquito-borne diseases like yellow fever. So one of the major responses for how we dealt with this was actually thinking about city planning and design and town infrastructure interventions. So after multiple cholera epidemics in 1842, the city said, you know, we're going to move the water supply from this downtown pond to the Croton Aqueduct in upstate New York. And after that, the cholera epidemics went away and they didn't come back once you had this clean water supply. 1857, Central Park was built, and it was called ventilation for the working man's lungs, because now whether you had your own big house with your own backyard or you didn't, you now had a place, a public place that you can go to get fresh air, exercise, sunlight. The Department of Sanitation was created in 1881 and started cleaning the city streets. The Tenement House Act in 1901 actually banned the construction of dark, airless tenement buildings. So now all buildings had to have windows where light and air could circulate and ventilation could occur. The first section of the subway opens in 1904 in New York, in large part because there was so much overcrowding in lower Manhattan and people need to spread out and live in other areas, but yet be able to get quickly down to the main areas of commerce and work, which was still in downtown Manhattan. And in 1916, New York introduced zoning that requires buildings now to be stepped back from the streets so that light and air could enter. And light and air then entered the streets, and those puddles dried up and those mosquitoes went away. So then what you saw was, you could see that in 1880, the leading causes of death were the infectious diseases that I was talking about 60% of deaths, and then nearly 60% of deaths. But by 1940, before the widespread use of antibiotics, because penicillin, the first antibiotic, was discovered in 1939, it wasn't in widespread use until after 1940, and yet the major declines that we saw in infectious disease deaths occurred between 1880 and 1940. You see a 46% decline. And of course, after we got medical technologies like antibiotics, we continue to see declines, but in fact, you could see it's relatively small in the decades after all of these medical technologies, but it was very large in the times when we actually made huge urban planning and urban design changes to our city. So that's a really important lesson, that the environment in which we live in our cities, in our towns, in our communities, fundamentally determine whether diseases will spread, whether we can be healthy, or whether we will be unhealthy and get sick. So our environments today actually have changed quite a bit. We have a lot of the issues like clean sanitation, ventilation systems. There are still areas, particularly impoverished areas, that could use with these interventions. So those are really important. However, in many of our other places that are being developed, we're developing also in an unhealthy way. And in fact, the environments that we've been creating globally have been described as obesogenic environments. In other words, if you live in them, you will get a different types of disease, which is obesity, weight gain, and then chronic diseases that come from being too sedentary, eating, maybe there's a lot of food, but unhealthy foods, being exposed to tobacco smoke, for example. And so one of the things that we do need to do is to look at our environments today and see what other changes we can make. And those other changes become really critical to address these underlying chronic diseases that actually also contribute to severe infections from pandemics like COVID. So today, the burdens of disease and risk factors have changed because our environments have changed in many countries. So you could see that the leading causes of death today are diseases like heart disease and strokes, cancers, diabetes, chronic lung disease. And as I mentioned, they affect every part of our lives, including infectious disease pandemics like COVID. So if you have heart disease and strokes, have diabetes, for example, chronic lung disease, you are at increased risk of dying from COVID and getting severe COVID. So chronic disease is now #1 cause of death globally, 41 million deaths per year. Over 70% of our deaths now are from chronic diseases. And then, of course, as I said, they also impact issues like infections and pandemics like COVID. Leading risk factors include, for these types of deaths, include tobacco use, physical inactivity, unhealthy diets, harmful use of alcohol. And then with those come things like high blood pressure, overweight and obesity, high cholesterol, that also contribute to a large percentage of deaths and millions of deaths every year globally. Obesity is a global pandemic as well that has tripled since 1975, with nearly 2 billion adults being overweight or obese and over 340 million children. And as I said, you know, there are studies that show that if you suffer from obesity, you also are at increased risk of severe COVID. Health consequences of obesity all over. As you can see, the entire body is affected, from the brain in terms of risks of stroke, to the heart, to liver, to increasing the risks of multiple cancers, to diseases of the limbs like gout, osteoarthritis, and reproductive abnormalities as well. Depression and obesity are also linked, as you can see from the slide, with increased risks of depression as obesity goes up. Mental health issues are also really important globally today. It's estimated about 5% of adults globally suffer from depression. And even though depression may not be a major cause of death, it is a major cause of disability worldwide. We also know that mental health issues, along with cardiovascular disease, heart disease, and also injuries, are leading causes of workplace disability. The world's population is also aging. And with aging often comes disability as well, I think, as Antika has talked about. So between 2015 and by the time we get to 2050, about 22%, 1 in 5, over 1 in 5 of the population will be over the age of 60. So that's going to be nearly double what it is today. By 2020, the number of people over the age of 60 will outnumber the children younger than 5 years of age. And in 2050, 80% of older people will be living in low and middle income countries. So the pace of population aging is much faster than it was in the past. And so a really important piece of this is to think about not just our health and social systems, but how do we design our communities so that as you get older, you can still live in them independently. You can still move about safely, to go get your groceries, to go to the bank, to go to the post office, to visit your friends. And so the aging in place and aging healthily really depends upon how we design our communities also. We also live in a time where climate change and environmental pollution is very important. Climate change affects the determinants of health like clean air, safe drinking water, having sufficient food because it can affect our food supplies, and secure shelter. So between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths per year, and reducing emissions of greenhouse gases through how we think about food, transport, and energy use choices are particularly important. And not only important to reduce air pollution, but actually they can also, these things where if we have better transport systems where we're using public transport, we're walking, we're cycling more, it's also good for our health in terms of physical activity. As you will see later. If we eat better foods, for example, if you eat fruits and vegetables, they reduce waste because you generate compostable waste as opposed to highly packaged and highly processed foods that come with a lot of packaging and transportation mods. Just to mention that social factors are also really important. For example, there are more and more studies showing us that if you don't have secure work, it has bad impacts on your physical and mental health. Stress at work can increase your risk of heart disease. And stress isn't just the feelings of stress, it's also how much control you have over your work. Is the work that you do, particularly if it's hard work, well rewarded and fairly rewarded? Anyways, so there's also studies on work conditions and what we can do at work to improve health. And then finally, social interactions and social supports are really important. So when people are supported by their interactions with friends, family, and other groups, they have better outcomes for issues like diabetes, high blood pressure, arthritis, lung disease. And if you have lower social involvement, so if you're socially isolated from people, your risk of things like a heart attack can actually increase by 50%. Okay, so because of all of this, the World Health Organization actually says that there are many factors that determine health. So you could see health services is only one of those factors. Of course, it's an important factor, but so are income, education, the physical environment that you live in, your working conditions, the social supports and networks that you have, personal health behaviors like healthy eating, active living, not smoking, and reducing drinking, or drinking in moderation and appropriate amounts. And so those are, all of these things are things that we can change, even if we can't change things like our sex and gender, our genetics, and then of course health services. But you could see that health services is only one part of creating a healthy population and a healthy community. So evidence of effective interventions that we can do related to fit cities and fit towns include how we design our communities. So communities that are designed where people live, where they can take their children to school on foot, where they can walk to the stores nearby, where they could even maybe walk to their jobs, to recreation areas, where they can walk safely, because there are sidewalks and pedestrian paths that are safe, where it's pleasant to walk. And you can shape that through planning policies like zoning, building codes, builders practices, government policies. These types of communities have been shown to increase physical activity by over 160%, to decrease isolation, and to also reduce people's sense of stress and crime. Street designs that complement that are also really important. So for example, if people are going to feel safe, you need good pedestrian scale street lighting. You need to be able to cross the street safely to get to your destinations. Traffic calming approaches like speed bumps, traffic circles have been shown to be very effective. Enhancing landscaping so that it's pleasant. I think in very hot climates, thinking about shading and issues related to protection from direct heat may be important to help with helping people with active transportation. Again, you can shape those things through design standards, through building codes, through the environmental changes that you make. And again, designs like that have been shown to improve physical activity, to increase people's sense of community and decrease isolation, and also reduce crime and people's sense of stress. Building designs are also things we can do. We now spend the majority of our time daily in buildings. And so, simple things like actually reminder signage telling people to take the stairs when they're standing at the elevator waiting. If they see these signs, like these New York City signs, we printed 40,000 of them during the Bloomberg years and distributed them to over 1,000 buildings. And just having these simple signs at points of decision, like outside of elevators, next to stairwells, can actually increase stair use by over 50%. Very high-rise buildings, you can program elevators. So one ADA elevator for all floors. Elevators that can serve people with disabilities, older people, people carrying heavy loads. But many other elevators can be made express and stop at every third or fourth floor. And so people who are able-bodied can actually walk several floors each day because they're going to a floor that maybe isn't where the elevator stops. Those types of buildings have been shown to increase stair use by over 3,300%. And you might ask, what might a little bit of stair use do? So there's a Harvard alumni men's study that showed that the men who climbed on average 20 to 34 floors of stairs per week. So if you divide that by 7 days a week, that's only 3 to 5 floors a day. They had a 29% reduction in their risk of stroke over a 13-year period. So these daily things that we do every day actually are really important to make stairs more visible. For example, there's materials now like fire-rated glass that allow you to encase stairwells, as you see on the left, and stairwell doors with glass, so it's more safe in terms of visibility. If you can find it, you're more likely to use it. You can see the stairwell when you walk into the building, you're more likely to use it. And then, more aesthetic and design interventions like music and art and stairwells. Worksite factors, social factors that build supports for coworkers and families, but changes to how we design our workplaces, the furniture we might use, the cafeterias and what foods they have available. Can actually all be really important. And there are actually studies that show that when we do these things, the workplaces become healthier compared to workplaces that don't do that. School factors are really important. So thinking about how children get to and from school, if they can walk to and from school, the better. If parents can walk them to and from school, the better. There are also group walking programs like walking school buses that can be instituted. But of course, that's only if your neighborhood infrastructure, like your walking paths, are safe for children and crossings are safe for children. Then when they get to school, whether they have enough facilities for physical education, how we design their playgrounds, even the furniture in schools. There are standing desks now that you can get for children. There's furniture where when children sit on the chair, they can actually fidget and move around. And that can actually burn a lot of calories as well through that kind of design parameter. Thinking about what we feed our children at schools in terms of school meals. There are also studies to show that when children are involved in gardening types of interventions at schools, so gardens at schools, children tend to eat more fruits and vegetables. And these types of studies have shown that when we do these types of interventions in schools, we can improve not only their obesity rates and physical activity, but actually their grades and their academic achievement. And then thinking about our food environments, from gardens where you can grow food, particularly in denser areas, thinking about community gardens where people can get little plots of land to grow fruits and vegetables, which is both an exercise activity when you're doing gardening, but you can also garner more affordable fruits and vegetables, to food retail, like do you have supermarkets and healthy foods like farmers markets and markets, rather than fast food and convenience stores, which are bad for you. And then even things like access to safe drinking water, both in our buildings, but also in our public spaces, like our parks, our pedestrian plazas, where people can get safe and free drinking water. And these benefits come not just for health, but there's been studies that show there are environmental benefits, there are economic benefits, there are social benefits, and we've already talked a little bit about the safety benefits as well as the health benefits. These are some slides from New York City, and you'll hear from Wendy a little bit later and about the work that Department of Transportation did that improved pedestrian spaces like pedestrian plazas, as you can see here in Pearl Street and in Brooklyn. So not only do you tend to increase pedestrians, which are good because people are walking around, but you actually can improve the economic development of the area in retail sales, you could also improve, you could see here that improving a bus rapid transit route in the Bronx not only increased bus ridership, but retail sales and economic development in that area. So what can be done? I think some really important to think about are basically having multi-sector dialogues like this one, where health folks can work with architects and planners and transportation officials and people who build housing and affordable housing, people who are working on environmental sustainability. And by coming together and working together and putting our heads together, we can build healthier and better cities. So multi-sector dialogues and conferences like this one. Then having multi-sector partnerships. So think about, after this conference, what are the things that you can do in Thailand by working together across sectors? So in New York City, we worked together to create a set of guidelines called the Active Design Guidelines, which you can get either from City of New York, or if you go to my website, www.drkarenlee.com, you can go to the resources page, and all of that, like the Active Design Guidelines and all of its supplements, are there available for free for you to use. We are creating a set of new guidelines because the Active Design Guidelines now is 12 years old. And so we're creating a new set looking at the current evidence called the Healthy Community Guidelines. And we're doing that with over 100 partners in Canada. So if you're interested, you should be able to get that off of our Housing for Health University of Alberta website very soon, later this year or early next year. Things like community engagement, research and evaluation, and pilot interventions are also really important. So this is just to say, this conference in Thailand now, it's a part of a legacy of many other conferences that have occurred globally. So really thrilled that it's come to Thailand as well. I talked about the Active Design Guidelines, so you could see, you could go to the website, drkarenlee.com, resources, the USA page, and download them if you're interested. But the Healthy Community Guidelines should be released actually very soon as well, in late 2022, early 2023. And again, you could see that there's various strategies at the neighborhood scale, site scale, and building scale, and including the lens of people of all abilities, that can be used to improve our communities. And then just to say, so currently I run a program called Housing for Health at the University of Alberta, and we have multi-sector partners. We've got pilot housing developments to improve the different size and types of communities. And we've got research and evaluation around it. And then just to say, you could see all of the outcomes that we were able to achieve during the New York years, working together with the other panelists you're going to hear from, including increasing pedestrian volumes, increasing stair use, increasing bicycle travel, increasing transit ridership, places for children to play, and increasing life expectancy faster and longer than the rest of the United States during those Bloomberg years. And then at the same time, safety improved. We decreased traffic fatalities 30%. We decreased sedentariness. We reversed childhood obesity, and then all of the positive environmental and economic impacts I've already shown you. So if you're interested in hearing the New York story more, there's this book called Fit Cities I was asked to write. It's available on Amazon internationally. And there's a whole bunch of websites you can use. You can come and join us in New York City in June each year for this 2-day Columbia University School of Public Health course called Designing Healthy Cities. It's been on hiatus the last couple of years because of COVID, but I'm hoping we can resume it in June 2023. So thank you, Antika. I'm going to stop so that folks can continue.
Thank you so much, Karen. I really, wow. It's the news perspective as well when we mention about the role of the city in terms of architecture or urban design field. We hardly see our role in terms of maybe we can prevent, for example, obesity, or encourage people to be more active, like design more attractive staircase maybe, but people can use stair more rather than elevator. And also I really like the way you mentioned about the co-benefit, not only for health, right, but also for other like environmental aspect or natural environment and also energy. I think we need more to explore on that. And as Karen said, there's a lot of more channels that we can search for the perspective of the environment in terms of improve health or do the health disease prevention. Thank you so much, Karen. So I like to move to our next speaker. We're with Jeffrey Shoemaker. Okay, he will share with us on the case study of urban realm, public-private partnership mechanism in creating public space and well-being. So I'd like to do a brief introduction for who is Jeffrey Shoemaker. Some of you might already know him in the field of urban design. Jeffrey Shoemaker, AICP, has been working at the intersection of architecture, urban design, and planning for more than 25 years in both the public and private sectors and in cities across the globe. He served the city of New York as its chief urban designer and director of urban design, and held leadership roles in some of the world's top architecture, urban planning, and design firms, including SOM, KPF, and BIG. Jeffrey is currently president of Urbanscape, an international urban design and planning consultancy he founded in 2002, taking the place-based approach to his work. Jeffrey is helping communities, architecture and planning firms, private and non-profit institutions, towns and cities create better places to live, work, study, and play. Jeffrey provides a full range of service from urban design, planning, and illustration to liaising with city agency and advising clients on strategy and public approval. Globally, Jeffrey is serving as expert advisor to UN Habitat on implementing the Sustainable Development Goal, or SDGs, as we very familiar on that. Participated into recent expert panel discussion in Seville and Madrid, and it's working with cities around the globe to build internal urban design capacity, mostly recently in Pretoria, South Africa, and Seoul, South Korea. Jeffrey also holds dual master's degree in architecture, planning, and urban design from MIT, and a Bachelor of Architecture with honor from Syracuse University. He is the recipient of the Public Architect Award from AIA, New York, and the Michelle Weil Award from the New York City Department of City Planning, both recognizing excellence in urban design in the public realm. Jeffrey teaches and lectures frequently and is currently an adjunct professor of urban design and planning for Columbia University and the Syracuse Architecture Program in New York City. Okay, Jeffrey, very impressed from your experience. So we hope to learn a lot from you. So the floor is yours when you're ready.
Great. Thank you, Antika. And thank you, Karen, for getting the whole gang back together. It's great to see you and Wendy and Lori. So let me share my screen. Okay. And can you see my screen?
Yes.
Okay, great. So I've titled this talk, Designing a Fit City, Start with Good Urban Design. As of course, I'm a little biased as an urban designer myself, but many of the things that Karen just talked about are really has been the focus of my career for my entire life, but a lot of the work that I did while I was at the city of New York. So I'll give a brief introduction. I'll talk about some, what are the principles of urban design, at least as we define them in New York City, a bit more about the active design guidelines that Karen introduced, and then how we aligned this with our own internal policies at the Department of City Planning. And then I'll end, hopefully I have time, I have a lot of slides, but I'm going to move quickly with a few examples from practice, most recently when I was Director of Urban Design at BIG here in the New York office. So brief introduction. Most of my career has been in the private sector. But in 2007, Bloomberg was mayor, and Amanda Burden, you can see in the image on the right, she was commissioner of city planning. And they wanted to bring back urban design office that once existed 40 years ago, and have a separate office of design sitting within the Department of City Planning. There was a great focus on the physical environment and many big projects happening at this time, which has already been mentioned. 2007 was also when Plan YC was issued, which is really the first comprehensive plan for the city of New York, acknowledging that the city was going to grow by 1 million people by the year 2030. But the plan laid out a way to do it that would also make the city more sustainable, more greener, more livable. For us in city planning, it's, and this may be obvious, but it's always good to remind ourselves that our work is really about people. Cities are about people. And we framed our work from that perspective of a person walking down the street. So you'll see we do a lot of on the ground sketches from that point of view, whether it's a retail street or a residential street, that interface of architecture and the public realm, the sidewalk, the street is really the primary focus of a lot of our work and attention. And really encouraging people. New York City is already an incredibly walkable city, but there's still room for improvement. I love this image on the High Line. Ultimately, I think this is our goal, right? To create places where people can come together and laugh and have fun. It's also, cities are where people come together to protest, and again, the streets, you'll hear a lot about streets from Wendy, but they really are any city's most important public space, truly public space. We expanded the public realm and added lots of waterfront parks, this one being Brooklyn Bridge Park in Brooklyn, in an area that was prior to this inaccessible to the public. So, you know, we as urban designers, architects, planners, we tend to use jargony phrases. And one thing we realized when we were talking to the public is that people didn't really understand what public realm actually meant. And so, you know, often our work was defining it, putting it in terms that people can understand. And again, streets, you know, streets not just for cars, you know, but for everyone. Our parks and plazas. We did a lot of freehand sketching. This is a sketch that I did when we were working on a Midtown neighborhood right adjacent to Grand Central Terminal. This is, you know, a sketch of what the potential is of turning a street that was really underutilized into a public space and a welcoming point for people coming into the city. Another sketch on the North Shore of Staten Island, one of our outer boroughs, where some industry exists, and showing how you can bring the public to the water while still maintaining an active waterfront. Looking at our privately owned public spaces, or in New York, we like to call them POPs. This actually comes out of our 1969 major rewrite of zoning, where we gave significant floor area bonuses to developers for providing public space on the ground floor. But unfortunately, the original rules didn't have much about design. So some of these spaces are really not spaces you would want to spend time in. So we spent some time rethinking those rules and looking at our infrastructure, you know, and here I'm focusing more on the space beneath the 700 miles or so of elevated infrastructure that runs throughout the city. You know, a lot of these highways were built in the Robert Moses era, and they really served to divide neighborhoods. And so we saw this as an opportunity, working very closely with DOT and other partners of restitching and reknitting neighborhoods back together. This is, I don't know if the video is coming through via Zoom, but just a typical image of what it looked like around city planning. A couple of urban designers sitting, sketching with planners, and just sort of, you know, sketching out the possibilities for a particular project. Working through projects, through policy. A lot of our work was developing urban design policy for the city. And then, you know, we have, you know, Karen mentioned the first zoning in 1916 and then the rewrite in 1969, but the zoning resolution is a powerful tool for regulating development in New York, not the best tool for regulating design. So we have a sort of added layer of urban design guidelines that we often produce for neighborhoods that get into character and kind of more of the finer grain detail that is hard to get into with zoning regulation. And a big role that we played was really advocating good design. And this was, you know, really working closely with our civic partners. In this case, this is the Center for Architecture, which is run by the AIA New York chapter. This was a charrette that we held for that Midtown project near Grand Central. You know, just an opportunity to get people together around design and thinking creatively about the city's future. It's talking about quality. We actually would substitute the word quality for design when we were talking to the public, because that's ultimately what we're talking about. And, you know, looking everywhere, of course, we have great public spaces in Manhattan, like this image of Bryant Park, and the High Line, which I and many others had the pleasure of working on, at least in the early planning days before the High Line became a reality. But it's going beyond Manhattan and the kind of center of the city and looking in our outer boroughs where we can also make improvements. And yes, I always like to show this image to non-New Yorkers just to say this is also New York City. We have many outer borough, very low-lying bungalow communities on the waterfront that were pushed to the front lines during Hurricane Sandy and continue to be on the front lines when we talk about resiliency and tackling climate change and sea level rise. Sometimes it's removing barriers. This image here would have been illegal not too long ago. In many of our streets throughout the city, we did not allow sidewalk cafe seating. So those of us, who would like to travel to Europe would go to Europe and see all this great seating outside and come home and wonder why we couldn't do it here. Well, it turns out our rules were prohibiting it. So loosening or removing rules to allow this to happen. And again, Wendy will spend much more time talking about our streets, moving quickly, often temporarily, just getting some public art into an intersection and defining that space can be key. And then we often have this I think false debate between public versus private. And in New York, it's really public and private working together. This is a sort of pop-up public space that was created on a development site before the building was built, adjacent to the High Line. Another example is one of the newer additions to our waterfront called Domino Park in Brooklyn. This is privately owned, privately managed waterfront space by a developer, but worked very closely with Department of City Planning and other city agencies and making sure that it was truly public and publicly accessible. But sometimes, having it be on private land gives you a bit more design freedom and including elements that you wouldn't otherwise be able to do if it was parks managed. Same developer a bit farther north is looking at a project which I actually worked on at Big, which is looking to get people really up to and into and onto the water. The Hudson, the East Rivers are becoming cleaner by the day. And hopefully one day soon we'll actually be able to get people in the water. So this is sort of planning for that day to come. A culmination of the 10 years working for the city, we finally, for the first time ever, actually put our urban design principles down on paper and made them accessible to the public. We posted these on our website. And, it really, we started out with a very elaborate set of urban design guidelines, and then we distilled it down to really 4 basic principles and put in language that, again, we hope that the general public could really relate to, starting with place, creating or reinforcing a sense of place. The example I'll give here is a neighborhood on the Brooklyn waterfront, Coney Island, which many know for it's one of the first amusement parks in the US and very popular. This is an image from about 1910 of one of the first pedestrian streets in New York. And then, as we often do, we like to sort of understand what makes this space unique, what gives it character, and making sure that as we write rules for new development, we don't prohibit these things from happening in the future. And then, as I said before, getting on the ground, this was what that same street looked like when we started this planning work and starting to sketch in, overlaying the set of rules that we were distilling and giving it a sense of character. All these are sort of internal sketches, just so that we kind of knew internally what we were hoping to get, but then also we use these for the public presenting as well. Another view, there's a lot of parking and other uses that really weren't appropriate in this location. So we wanted to connect some of these landmarks that still existed and create a much more walkable community. Second principle, equity. Making sure that everything we do and the city is open and accessible to everyone. The example I'll use here is a neighborhood called East New York. It's one of the poorest neighborhoods in the city in Brooklyn, not far from the airport. It's a neighborhood that most New Yorkers just pass through, not realizing, not thinking that this is actually a neighborhood where people live, had not seen any investment in decades. So the work was taking some existing assets like a fairly significant park and creating lots of new spaces for active recreation and making it feel safer and more open to the surrounding community. Coming back to our street, so as we add affordable housing and more people, more density to a neighborhood, thinking about how they're going to get around, putting bike share in, creating more seating opportunities, adding landscape, for all of the sort of physical and mental health benefits that Karen mentioned. Even in our industrial areas, we have a lot of people walking to their jobs and, just things as simple and basic as putting in proper crosswalks, adding lighting to some of these elevated structures, adding signage and planting. It's an industrial neighborhood doesn't mean it can't also be green. For the third principle, detail. Even though in urban design and planning, we often zoom out, it's also important to kind of zoom in. The example I'll give here is a competition that we held. Again, this was during the Bloomberg years where we wanted to introduce smaller living. And we actually spent some time figuring out how small we could make it and still meet a number of codes that were already in place. And then we again turned to our partners at the AIA to use the Center for Architecture. And for the release of the competition, we actually taped up in full scale one of these units so that people could come in and get a sense of size. I don't know if you can see the cartoon on the left here, but they got a lot of press, but this is the more flattering, kind of poking fun at the whole idea, of what it means to live in a small apartment, and this was a pilot, as was mentioned. We did a lot of pilots in the Bloomberg years, and so it became a real project. It was built using prefab construction. This was really one of the first in Manhattan, so we were excited about that potential as well. And then the building was open and fully occupied. And the reason why I included this example, because a lot of people want to live in a neighborhood that they can't afford to have a big space, but they would prefer to give up some private space to be in a location where they can walk to their job, for example. They can be close to restaurants. So this sort of just added another whole possibility to housing opportunities in New York. And now we've actually rewritten citywide zoning to allow for these smaller units to occur as of right. And then finally, it's about comfort, making people feel good, feel safe, as you're experiencing the city. And Karen mentioned following the active design guidelines, we did a subsequent study just focusing on the sidewalk, where we sort of codified the view that we often took in the urban design office, the view of somebody walking down the street, more of that kind of three-dimensional experience. So I'm just going to quickly go through the active design guidelines. Karen mentioned it, but one thing I just wanted to say here is that, by the way, Antigua, your response to Karen was wow. I think that's everyone's response after they first meet or see Karen in action. I mean, she was really the force behind creating this really groundbreaking, award-winning set of active design guidelines. And as far as working across agencies, I consider this the most successful example during the 10 years when I worked for the city, of just bringing planning, health, transportation, so many different stakeholders and parties together to create these guidelines. We were, as the planning agency, very focused on the kind of urban scale. And in many ways, it wasn't necessarily new. We were already talking about mixed use. These are just good, solid planning principles, but it gave us a new lens to look at it, to talk through the lens of health about why is it important to have a mix of uses, to encourage people to walk, get people out of their car, providing easy access to healthy foods, creating parks and plazas that are within a short walking distance, roof parks with community gardening, lighting, seating, all of these things. The health evidence shows that they're good for people. So as a designer, I was excited, because often people kind of roll their eyes when you talk about good design, but when you can have the evidence to support it, it just it makes people listen who maybe otherwise wouldn't. And then again, of course, Wendy will talk a lot about, the importance of streets and making them safe, accessible, places to sit. I mentioned the sidewalk cafe seating. Now it's every community wants it on their street, integrating public art, dedicated separated bike lanes, signage. We have this incredible transit system, subway system in New York, and build on it as much as we can, placing density where the transit is. This was already mentioned. There's kind of synergistic value here as well between active design and sustainability, and also universal design and accessibility. So we took the guidelines and we sort of applied them to many of our internal policies within planning. And again, placing our maximum development close to transit to encourage people to walk. It's very trendy now to talk about the 15-minute city. Well, 15-minute city is also a healthy city, a healthy neighborhood, making sure that everything is within a short walking distance of where you live. It's really about creating healthy neighborhoods with housing options and all sorts of things that you need in your daily existence. We developed the FRESH program, which FRESH in this case stands for Food Retail Expansion to Support Health. The map on the right is mapping out food deserts across the city. These are neighborhoods in the city that did not have easy access to fresh foods, grocery stores and the like. And so we developed a program called FRESH that through a series of zoning incentives, whether it's additional floor area or tax incentives, for developers to provide fresh food, grocery store examples within their development. We now require bike parking, indoor, protected, safe bike parking, because we know that one of the barriers to people using their bike is that they are afraid to park it out on the street. And so now all major development in the city requires indoor bike parking. And these are some of these earlier pops that I mentioned before. We changed the rules for design. These are public spaces, but you wouldn't know it by looking at them. And so we added many rules looking at providing seating options, shade, greenery, and again, not just for encouraging people to walk and be more physically active, but also for the mental health benefits that we are just beginning to really fully understand and appreciate. I think one of the great legacies of the Bloomberg, there are many, but one of the great ones is really returning, rearranging, reorienting the city to its waterfront. The city has 500 plus miles of waterfront, making it publicly accessible and allowing for all sorts of active uses to happen along the edge of the water, on the water, in the water, et cetera. Coming back to this study, which, as Karen mentioned, is freely accessible and downloadable. This report where we allowed us to really codify and put in writing the all-important sidewalk and what it takes to create a great sidewalk, and really viewing it from the pedestrian perspective. This just a list of all the stakeholders and agencies that come together in the sidewalk. Again, we were sort of viewing it not as just the two-dimensional surface that you walk on, but as the three-dimensional experience as one walking down the street, and really pulling it apart in the four planes, looking at the ground surface, what sort of materials exist, do you have planting, what do you see when you look toward the street, do you have street trees, do you have parallel parking, is there a bike lane? What happens when you look up? Do you have a tree canopy that's going to provide shade and make it more comfortable in the summer months? And then I am a bit biased, but I think that actually the most important plane of a sidewalk is not the sidewalk itself, but actually the ground floor of the adjacent building. And in our case, in city planning and zoning, we have a lot to say about what are the uses that can exist here, what levels of transparency, what does the signage look like, that, when all together, these four planes creating that sidewalk experience. And then in the remaining minutes that I have, I will quickly run through just a few examples when I worked at Bjarke Ingels Group, BIG, the New York office, where I was Director of Urban Design and Planning. A bit on the history. The firm started in Copenhagen. Its first project was actually a harbor bath. And this was kind of it was really a celebration of the cleaning up of the harbor, the Copenhagen harbor, clean enough to swim in. And when you go to Copenhagen in the summer, it looks like this and then some. It's everyone, seemingly the whole city comes to the harbor, particularly during these hot days that we've been having. And this was the start. There's a whole series of these now that just line the Copenhagen harbor. The early days of the firm they were very focused on social housing, and I include the 8 House here because I think it's a great example of how you can kind of weave in, encourage people to walk, to bike, really from the city to your front door, creating all these, and of course, this being Copenhagen, lots of bike parking, and these sort of semi-public, private places that people can come together. There's a great video of this building during the early days of COVID, where people were isolating, but because of the way the building was designed, it really allowed people to isolate together. And I think that's something that we should be thinking about more and more, is how hopefully we don't have more pandemics, but I think it's it's just, again, good planning and design practice to really weave in the public into our more private worlds. More recently, you may have heard of this project, the Copenhill, which is it's a waste to energy plant, but I'm not sure who, I don't know if it was Bjarke Ingels or somebody in the city side that came up with the probably crazy idea of putting a ski slope on the roof. But it happened, and now has become one of the major tourist attractions in Copenhagen. You can see here, it's a great spot for people to just have fun on the roof, be physically active. There's also a great hiking trail that runs along the ski slope. I think the world's tallest climbing wall, although maybe for obvious reasons has not actually been used yet. Doesn't look particularly safe, but it's there. And so, my role really, because I was in the New York office, was trying to bring some of that sensibility, that Danish sensibility, to New York. And then, of course, building on the 10 years when I worked for the city. One of the projects was looking at downtown Brooklyn. We've seen a lot of development because of changes in zoning in downtown Brooklyn over recent years, but not much changed in the public realm. And so, working with another firm, WXY, and the Downtown Brooklyn Partnership, which is the BID, we did a whole sort of public realm plan to make the public realm of downtown Brooklyn more engaging, to make it greener, to make it safer, more walkable, and really a destination in and of itself. So you'll see, and some of the and it was through a series of shared streets and pilot projects throughout the multi-block neighborhood, and a little bit of before and after. This would never be built in New York, and probably shouldn't be, but it was more about getting people excited about the potential and just bringing bold color into the public realm, rethinking what kind of furniture is there, blurring the lines between where people and bikes and even vehicles are, and creating more of a shared street arrangement, which is much more common in Europe and not so in New York or in the United States. Our underutilized alleyways and the sort of intimacy of those kinds of streets, and how they could be places for play, for gathering, for greenery, even keeping some of the street art in place, and how we can build on that and create, again, a sense of fun. Another example is what we call the Brooklyn Queens Park, which was essentially taking a highway that runs along the edge of the Brooklyn Heights neighborhood that fronts onto the Brooklyn Bridge Park, which I shared an image of earlier. Quite an engineering feat in its day. It's a triple cantilever with the promenade, the pedestrian promenade at the very top, and then 2 directions of highway beneath. But it was, and this is just an image from the promenade, it's quite a popular spot in Brooklyn to view the Manhattan skyline. But it had not been maintained, or just the sheer age of the structure was starting to crumble. So something needs to happen. So we looked to other cities, as we often do. This was the former Embarcadero elevated highway, which an earthquake brought down, and now has been replaced with street level access to the waterfront. Even in New York, on the west side of Manhattan, we also had a similar transformation of an elevated highway to what is today a series of parks that run along the west side. And even looking to Brooklyn's own past, we found this rendering showing the kind of more seamless connection between the waterfront and the Brooklyn Heights neighborhood. And so a series of diagrams, this was the current condition with the triple cantilever, the promenade at the very top, the triple cantilever highway, and the new Brooklyn Bridge Park on the right. Just showing that we could take this traffic, put it underground, create a more seamless connection. A la Highline, you could even keep the original cantilever and turn it into a park if you'd like, or you replace it entirely and create this connection. And then just a few views of what it does. You can see the highway there running along the park, quite noisy, polluting, and how that is transformed when you create this more seamless connection. I think probably the most dramatic change here is when you remove the elevated highway and create a park. It suddenly opens up the waterfront much more so for residents in the community. And the last example I'll run through very quickly is the Brooklyn Bridge. We entered a competition that the Van Allen Institute held, which you probably heard about. The Brooklyn Bridge is quite a significant landmark in the city. First time connecting the borough of Manhattan and Brooklyn, and it was a time when the city was growing in size and population. The pedestrian portions of the bridge have been squeezed. This was also at a time when the pandemic was just hitting New York, and so people were using the bridge in a different way. A lot of people were nervous about taking the subway, so people would walk from one end to the other. It was also when the Black Lives Matter marches were happening everywhere, and so the Brooklyn Bridge became this sort of iconic location for marches. But we looked back in time, and in its heyday, it carried 425,000 people on average per day. And then this history is the same everywhere. As cars were introduced, we removed a lot of this infrastructure that moved a lot more people more efficiently, and then that number dropped to just 160,000 people per day. And then also squeezing pedestrians and bikes all together in this very narrow strip at the very top of the bridge. So we saw it as an opportunity. We worked with the engineering firm Arup to look at, well, what if we just close this off to cars entirely? We have other bridges that can bring people over. We also have congestion pricing that is coming to the city. And so we did a series that shows how gradually over time, this has happened. At least one of these lanes has been put in to really get the bikes off of the upper level, so that could just be for pedestrians. And now bikes can run down below. And then gradually over time, adding in shared transit, converting the whole south side of the bridge to a long plaza, the kind of people's place, people's plaza, as we called it. And then you can even accommodate autonomous vehicles in the future. And then just a few more views of that transformation over time. In a temporary fashion at first, just to claim that space, and then more permanently over time, and how this bridge can now accommodate a whole lot of activities than just cars. And then we also looked at this sort of abandoned space at the anchorage of the bridge on both the Manhattan and Brooklyn side, and how we can give that back to the community as well, and really expand the public space. And this view I really like, because it shows when you strip away these car access points and really allow the bridge to be what it was always intended to be, the sort of great landmark, unencumbered by vehicle traffic. And then of course we can't resist. We just kept taking the same idea and said, what if we create a series of people streets throughout all 5 boroughs of the city and really reimagine our streetscape, and all the benefits that we've talked about that come along with it, from mental health to physical health to the environmental to universal, and on and on. So with that, I will stop, and thank you again.
Thank you so much. Oh, I really enjoy a lot of, I know that behind the story that a lot of challenge, because what we have the perception about New York City, like a carless city so far. And you say that, of course, that change to be people first and also people center of the city. And I think more challenge is that when we mentioned about the active city to encourage people more active in different ways, either walking or even skiing on the building. It's amazing, isn't it? And how we can handle with the different speed of the people in the city, like elderly, sharing the street with the young kids who are roller skates, for example. So I think we need to learn more on that. And also we learn very strong inclusive design process since beginning with the different, the wide range of the stakeholders into the starting the policy into practice. And I really love the details, a lot of that. That's a pity we have a very short time. Thank you so much for Jeffrey for this session. And for the audience, if you have any question or comments or anything you want to share with our speakers, please do so. You can even type on the Facebook comment as well. Thank you, Jeffrey, for this session. And I will share a bit our next speaker. We're gonna move to Rolly Kerr. She will share with us another case study about the indoor environment perspective on encouraging people keep active and healthy. I'd like to use this opportunity to share a bit briefly about Rory Kerr. She is the president of LK Policy Lab. Rory Kerr is an architect and the national leader in green building and urban sustainability policy. Under Mayor Bloomberg, she led the development of the nation's first comprehensive green building and energy efficiency strategies. At NRDC, she founded the City Energy Project, which is now assisting 35 leading American cities in adopting policies like New York's. And she is currently advising organizations on how to achieve a low carbon future. Her awards include the USGBC's Leadership Award, AIA New York's Public Architects Award, and fellowship in the American Institute of Architects. And she also holds degree from Yale, Harvard, and Cornell. Hi, Rory. We really even impressed about, we start from broader picture and now we want to focus more on detail in the indoor environment and how you encourage people to keep active in the city. Please, Rory, if you're ready.
I am, and thank you for that introduction. And I want to echo Jeffrey's comments about Dr. Karen Lee. Anybody who's worked with her knows that she is a force of nature. And without her, most of the active design work in New York City would not have happened. So let me share my screen.
Yeah, you can press on the green button here, there, share.
There we go.
Okay.
And
okay.
There we go. And I just want to echo some things that were sort of coming up in Jeffrey's presentation. I think sometimes you might think that designing for health is going to be somehow counter to good design, which should be all about form and interesting ideas. But it turns out that the more people have been interested in health and sustainability, the more buildings have become more beautiful, lighter, airier, more interesting places to inhabit. So encouraging physical activity in buildings is not really counter to good design. It really is part of making beautiful and spaces that are delightful to inhabit and move around. So with that, I'm going to talk a little bit about an example, a success story in recent years of dealing with public health issue in buildings through better design practices. And then with that background, we'll start to take a look at handling the obesity crisis through encouraging active design. So as Dr. Karen Lee was saying, people spend most of their time indoors, and this has got to impact their health. So let's go back in time to the 1970s when there was a energy crisis, and people started to make the buildings much tighter so that air wouldn't escape and they would save energy. And what happened was people started getting sick. They had problems with their central nervous system, headaches, fatigue, lethargy, skin itching, diarrhea. They had inflammations of the eye, nose, and throat, chest tightness, and so on. It was labeled sick building syndrome. And what had happened was that basically, for a long time, we had been creating building products and equipment that went in buildings and cleaning equipment that were full of toxins. And because our buildings were fairly leaky, we weren't that aware of how toxic those materials really were. But once we started to seal them better, the impact of those toxins became very clear. So what happens? Well, people start to address this and say, we've got to encourage products and buildings that are less toxic, that aren't going to be causing all of these health issues. And the LEED rating system was developed in the late 1990s. And the idea was you weren't just going to address energy use in buildings, you have to actually think holistically across all areas of the building. Otherwise, you're going to solve energy and you're going to create a health problem. So you needed to think across all of these issues. And just to be open, I'm currently consulting with US Green Building Council, but they created this LEED rating system that included a whole area dealing with the reducing toxins in buildings. So what happens? The LEED system is a system which has now been copied. We're going to talk a little bit about some follow-on systems that just deal with health issues that are kind of based on the LEED model. But the LEED model basically looks across various impacts on buildings, from energy to water to siting buildings for better public transportation, a whole array of issues, and encourages building owners and building designers to do better practices. So part of the original LEED developed in the late 1990s included a whole set of incentives to reduce the toxins in building materials and in cleaning materials and in equipment and in smoking that were causing these ailments. And what happens? Manufacturers start creating a whole set of low VOC and low formaldehyde products. And as proof of concept starts to happen in that world, the government starts to ban many of the worst products, and indoor smoking starts to be banned, I think first in New York and then going around much of the world. So it's a success story of how problems like this can be addressed, in this case through largely through a voluntary system that proves that better materials can be incorporated, and then it goes to the large scale through government policy. So let's look at the obesity epidemic, which Dr. Karen Lee discussed, the broad ramifications of that. It's not just that people are heavy and have diabetes, it also makes them prone to more prone to die of COVID and other things. So buildings, what do they have to do with this? Are they part of the problem in the obesity epidemic? And I think at this point, they largely are. People are largely inactive. So you have people moving from, sometimes in many countries of the world within a generation or two, leaving very active lifestyles in the countryside, moving to the new urbanized cities and sitting in offices all day long and not moving much at all. So what can be done? Can buildings counteract weight gain by encouraging activity? So this was the question that was asked by the New York City Department of Health. And just looking at stairwell use, if you could encourage people to use the stairs, each flight burns 3 to 5 calories. So if people climb 2 flights every day, they would combat a ½ kilo of weight gain a year, basically. And this is actually seen a lot in New York. There are the old tenement buildings in New York that were built before elevators were really common. And there are a lot of elderly people in their 80s and 90s climbing up the stairs because those stairs keep them slim and keep them in shape. So the proof is really visible in the city. So to look at what some of the options would be for physical activity in buildings, a group of people came together and worked on the active design guidelines. And I'm just going to give, some of the big picture, some of the main areas for active design and combating obesity through how buildings are function and are designed. So the first, of course, is encouraging people to use the stairs. And a lot of stairs in New York City are, quote, back of house. They're enclosed in cinder block and they're not designed to be attractive at all. They're just designed to get people out of the building in case of fire. So the first step is to take those stairways out of the back of house and bring them to the front of house, make them design elements and make them available for everyday use, not just for escaping in case of fire. Make them visible and appealing, push the elevators back so that they're less prominent and people are more likely to take the stairs. Make the stairs wide enough, make them comfortable and easy to walk up and down, and ensure that they're safe and well lit, which currently many of those back of house spaces feel a little frightening because they have opaque doors. And as Karen was saying, you could put a fireproof glass panel over that door, and then you would be able to see in and see whether or not it was a safe condition to enter there. So all of those things can help to encourage more use of stairs. Also, another major strategy is to get people to walk more in buildings. So you want to locate functions so that they're not always that close to each other to encourage more walking. You want to make the paths of travel again pleasant, visually appealing, interesting to be in, with events, things happening along the way to keep your interest. Daylight and infrastructure, things like bathrooms, places to eat along the routes, so there's a reason to take those routes. And feedback is also very helpful. Everybody loves their Fitbits. And similarly, if you built that into the building, telling people how far they've traveled, people like that. People like knowing how much physical activity they've actually done. A third big strategy is to include bicycle storage and showers. This is really somewhat to assist with the infrastructure in the public realm that Jeffrey was talking about. You know, it's all great to have bike lanes and to encourage people to run, but if the place that they're getting to doesn't have a place to safely store their bike, they can't shower, then they're not likely to want to bicycle. So buildings have to play their part in that, but it also can enable people to not just commute in a more healthy manner, but also to do physical activity during the day. Exercise rooms are also an important amenity that buildings should be providing for people. And they shouldn't just, again, be back of house rooms stuffed in the rear of an underutilized space. They should be brought to the perimeter of the building so that they can have light and air. So it can be a beautiful space to be in, one where you can interact with the outside, where it's an appealing, pleasant place to be. And then since the design guidelines were developed, other strategies have become popular too. Active furniture, so ergonomic design of better desks, and like 10 years ago, people were sitting at their desks on computers, and the seats and the keypads were poorly designed, and people were getting they were getting carpal tunnel syndrome and damaging their nerves and so forth, doing repetitive work. So including ergonomic design is very important. And then in addition to that, including desks or seating that while people are working, they can also be getting a little physical activity, either by just standing at their desk when they want to, or actually walking slowly on a treadmill, sitting on an exercise ball. Another strategy is to provide healthy foods. So, you know, one way of combating obesity, of course, is to exercise more. Another way is eating better, and buildings have a big role to play in encouraging better foods. If there's a cafeteria You want to put the healthier foods in a more visible area so that people are drawn to those first. Make sure fruits and vegetables are available. Make sure water is available so that people aren't drinking sugary drinks. And make sure that if there are water fountains available, that you can fill a bottle of water so you aren't buying unhealthy drinks or expensive water. Transparency, so how many calories, what the nutritional content of food, making that available all helps people make smarter nutritional decisions and provide smaller portions. So two systems have been developed. They both came about in around the same time, and they followed lead in their basic concept. They provided a set of strategies, or they encouraged a set of strategies that designers could use, and they could get points for achieving each strategy. And then if a building achieved enough points, it would get some recognition. So Fitwell was a certification that was developed for active and healthy design. So LEED is very broad. It's about energy. It's about sustainability and a little bit about health. Fitwell focuses on healthy design. It doesn't worry about sustainability, healthy and active design. And it has 12 categories, which include location, building, location, in other words, being being in a walkable community, for example, being near public transportation. And so there are all these categories that encourage activity, encourage more outdoor spaces, for example, encourage activity. Stairs, we've talked about having entrances that are more accessible, better workspace design, as we've shown, that have that encourage more physical activity, more walking from space to space, shared spaces like the exercise rooms and so on. So Fitwell encourages this whole range of strategies. And if you look at, for example, focusing in on just the stairs, you can see that it addresses a lot of the concepts that I've already mentioned about encouraging stair use, provide at least one stair connecting building, public stair that connects building floors, make the stairs more prominent. So Fitwell took a lot of the ideas, particularly in the area of physical activity, from the design guidelines and put them into this LEED-like system to encourage physical activity. A second similar system that was developed to help design teams create more healthier buildings is something called the WELL Building Standard. And it encourages about 110 specific strategies, and it has 10 concept areas. So it's much broader than Fitwell. It includes everything from, better air quality to, things like mindfulness, calmness, things like that. So it goes way beyond it's much broader than the fit well, but again, focusing on health and mental health and wellness in this case, less on physical activity, although it does have one section on movement. And so you can see it encourages that range of physical activity, that range of design strategies to encourage more physical activity. So ergonomic workstations, circulation network. So again, this is well focus on movement. Again, many of the concepts that were originally created with the active design guidelines found their way into this now international system, which is encouraging activity, physical activity in building design everywhere. I talk about these nonprofit voluntary strategies for helping design teams achieve active design in buildings, because this is one of the primary ways that these strategies are now being promoted. And they're not just in Europe and America, there are a couple of them in Bangkok. So I thought I would bring this home by looking at two exemplary Thai projects that are already excelling in this area. So the first is the Stock Exchange of Thailand, and it has the highest Fitwel rating, 3 stars. It's the first Asian project to have achieved Fitwel rating. It got the Best Building Health Award in 2020 for a single tenant building, and most of the strategies increase physical activity. Some of the strategies that building uses is restorative garden, and a fruit and vegetable garden, and a courtyard area. So outdoor spaces where people can go out and be active and enjoy greenery. And it's designed to increase occupant physical activity. There's a fully staffed fitness center, which is free, and it provides exercise programming, personal training, classes, and lots of types of physical activity. And then there's a farmer's market on the site with regular access to fresh foods. So again, physical activity is one piece of this. Access to healthy foods is another piece of combating the obesity epidemic. So a second project in Bangkok is this Research and Innovation for Sustainability Center, which achieved the highest WELL rating. It's a gold. It's the first Southeast Asian project to receive WELL Gold, and it's really the mission of that institute is really aligned with the WELL rating, because the research focuses on health and wellness and materials and resources. So some of the things that project did, I'm just going to, it did a lot of things related to health. You can, I've included some links at the end of this, so you could go and look at all of the things that were done there. But just the ones related to activity and food. They have ergonomic design of the workstations so that the desks are height adjustable. You can sit down, but you could raise them and have a standing desk. There are also desk pedals where you could be walking as well. There's a cafe zone with a nutritious, healthy pantry, which includes vegetable garden cabinets and vending machines with healthy foods. The design of this overall is this elongated space with lots of different types of spaces along the way. There's a materials library, there's a place to sleep, there's an area that's for noisier functions. So people are going to be moving around this space all the time. And because of its elongated form and the distance between these various functions, people are going to get a lot of exercise just moving around throughout the day. And finally, this space has areas to sleep. So, you know, rather than just using caffeine, people could take a nap during the day, and obviously being able to sleep enough. People don't typically get enough sleep. So being able to sleep enough is a huge piece of health. And this is just designed into this project in Bangkok. So here are some useful links. Maybe we can give these to folks afterwards, where you can find out more about these projects and more about some of these standards that are codifying the strategies for healthy and active designs in buildings.
Okay. Thank you so much, Rolly. We learned a lot, the role of the indoor environment, not only for design or decoration that people can live in, but also can, like a mirror, to reflect the quality of life of people. And thank you so much for the case studies, so that the audience they can visit these two cases as a set and also risk building in Bangkok. Okay. Sorry if we run behind the schedule of the time, and if the audience have any question or comment, you can also do so in a comment on our Facebook. Thank you, Rory. So we'd like to move to the next speaker. The last but not least, Wendy is still with us. I'd like to take this time briefly introduce about the Wendy Fuhr. Hi, Wendy. Thank you so much, Rory. So you can a bit relax now. Okay. So for Wendy Fuhr, over the past 40 years of her experience in her career, she has focused on the improving the built environment to encourage people to use the mass transit, walk, and ride the bicycle. She has approached the goal of making the public realm more inviting first on a policy level, while working on staff of the New York State Assembly championing artists' rights and holistic preservation legislation. Fuhr then worked for the New York City nonprofit organization advocating to improve New York City 578 miles, 578 miles of waterfront on a programmatic level. She was hired by the Metropolitan Transportation Authority to create the LEAD, a program, Arts for Transit, to integrate permanent, temporary, and performing arts into region's mass transit system. The program won multiple local and national awards. As a consultant, Fuhr worked with government, private sector, clients, and nonprofit organizations on a variety of projects, from commissioning art for JFK Terminal 4, Hudson River Park, and Brown University to managing a team of architects and landscape architects on a campus planning study for Columbia University. She also worked closely with the Cathedral St. John, the Divine on a real estate development project. Finally, Fuhr worked for over 13 years at the New York City Department of Transportation in a newly created position of Assistant Commissioner for Urban Design plus Art plus Wayfinding. While there, she led the team that created the first ever New York City Department of Transportation Street Design Manual. The third edition of the manual was published in 2020 with an accompanying website, those whose pages have been accessed many thousands of times. Elements of the street design manual become part of New York City's active design guideline. Fuhr has written articles on the subject of public arts in a public sector environment and has participated in panels and lectures at the university and conferences on public arts and design, including at an international conference on transportation and public art in Taipei in 2001. Oh, Wendy has a lot of experience so far in both public, outdoor and indoor, particular of, like integrated urban design and art, including wayfinding and also encouraging people to do active activity in the public places. Okay, Wendy, when you're ready, you can share your presentation. Okay.
So I entitled this Reimagining the Public's Realm, and that's intentional because people pay taxes and it's their realm as much as anybody else. One of the first things I wanted to do was ask people what they saw in this picture. This is a residential street. It's actually right in front of my house. And probably people see just a regular street. About 15 years ago, I would have said the same thing, but now I say I saw something different, and it started with a lecture by an urbanist who's unfortunately died, named Michael Sorkin, about 15 years ago. This is what I see. I see public space being used by private use. I see 90% of the space for cars moving and parking and 10% of the space for cyclists. And I think that's a problem. And I think it's a problem we've all been talking about today that we have to remedy, and that we have been remedying in New York City, fortunately. First, and I think this conference is evidence of that, recognize that there's a problem. I think we all understand too many deaths by cars, the environment is a problem. Even if we have electric cars, there's still going to be congestion, and that's a problem. So we have to reframe the issue of what a public space can be. And then we have to implement the new visions. And I think Jeffrey showed some of those visions, and hopefully many of them will be realized. So Jeffrey talked about this a bit, about what is the definition of public space? What's the definition of a street? So over the past 20 years or so, we've been redefining the concept of a street. Jan Gehl, and you were in Norway, and Tika, was a leader in this, and in Norway has been trying to do this in Copenhagen specifically for over 40 years, have been trying to create and flip the idea of what's the space for cars and what's the space for people. Not only for environmental reasons and health reasons, but just in terms of livability. But, it's interesting that Dr. Lee showed a picture, and I think other people showed pictures of New York City in the early 20th century. Certainly, it was not the best place to be. There's a lot of health issues that were there, but the way I see this picture is people were on the street. The proportion of carriages, horse-drawn carriages to people was 90 for people, 10% for carriages. But that image, and certainly there were, as I said, health issues, but I do think that it's the idea that streets were for people, for activity. But then in the 1930s, and this is a picture from a book by James Sanders that talked about the future of the city, and the future of the city. And this was the image of the future of the city in a film from the 1930s about what the city would be in 1980. Again, I'm going to ask you to look at it. Dominated by cars. Where are streets? Nowhere. What's the reality? We know too well that this is the reality. And it's interesting, in preparing for this talk, I sort of Googled Bangkok especially, and saw the same thing that you see here, people running between cars, trying to get across the street. And that I saw pretty harrowing videos of that. But this is more reality today. So we wanted to deal, one of the first issues was dealing with space and taking space back. Once you recognize there's a problem, you recognize what space is for, the definition of public space changes, and then you say, we're going to take it back. And that's what we've been doing in New York City over the last 15 or 20 years. This is not the fantasy of the future. I'm sorry, I forgot this picture. This is the fantasy of the future. I skipped over it. And this, to be honest, scares me. It terrifies me because I don't see people walking. They're in their own little pods. Even the thing on the left, or however you're looking at it, is electrified. People are in their pods. They're not walking. So this is not a picture of an active city, even though there's ample space. But what are people doing? They're riding in their little cars. This is a reality now of streets in New York City, and one that we really want to see more of. The fact is, after buildings and parking lots, streets are 27%. That is the space from building line to building line. It's the sidewalks and the streets and the roadways. That's a big percentage of what the public space is. And it's an opportunity to see streets as one of your city's most valuable public assets for continued growth and sustainability. The lesson from New York over the past 20 years is that you can restore, reclaim, and remake these assets to improve public health and overall quality of life. But it's not easy. I hope you're seeing this in the full picture of it. I'm going to put her in there. So what happens is people are used to, it's a habit. They're used to having the privilege of parking their cars. They're used to having the roadway space. They're used to it. And so if you take away space, people protest it. And in New York, that protest can be loud, and in New York City, litigious. There have been many lawsuits about this. So it's not easy. I want you to know it's not an easy thing, but these transformations, they're going to be fights over time. And there's a reason my former commissioner, Jeanette Sadiq-Khan, wrote a book with Seth Salamano entitled Street Fight. I'm going to try to sort of get you Street Fight, a handbook for an urban revolution. So you're in it for the long term. The problems can also be internal as well as external. As you can see, and this is taken from the street design manual, there are many, or a number of people and agencies within New York City that are fighting sometimes in this competition for limited public space, especially in urban areas. And I'm sure that's the case in Bangkok, that there's limited public space and who gets to own that space and decide what to do. But here are some strategies that we've tried. Look at this, very simple, right? French barricade, put on the street, no cars. This is part of what happened during COVID. We closed streets during the week called open streets. And then on the weekends, it's called open streets, open restaurants, where restaurants, as you can see, started putting their restaurants out on the streets and taking up that space. Polly Trottenberg, the commissioner after Commissioner Sadiq-Khan, said that when we would do plans for streetscape projects, people in neighborhoods would cry over losing maybe 5 parking spaces in the area that they thought that they owned so that they could park. And here during COVID, we probably took away maybe 10,000 parking spaces. And she said there was hardly a peep. A little different there, right? Now, So that's the first level. It's temporary and it's very quick and very easy. Then you have, this is a classic sort of A to B that Jan Gehl talks about in New Yorkers, as you may know, and I'm sure it's similar in other urban areas. People want to get places fast, but this is in a residential neighborhood. It's not attractive. So the idea was my staff worked with the local business improvement district on one block in one neighborhood to create a space that people would want to linger. Simple, we added a bench, we added planting that they maintain, and as you can see, it's a bike rack. And you can see somebody sitting there. Nobody was even able to sit there before this. So these are the incremental. So first is temporary, very easy, put up a French barricade. Second, you do one block as a template for what can happen. And then you have to have your major capital projects. Most people look at Times Square, but I wanted to focus on Long Island City. It's a transit-rich area, very unpedestrian friendly. It's most of the space has been developed for cars or houses cars parking. In a certain sense, to go back to the first slide, in a certain sense, it's 45% of the people in New York City own cars, 55 don't own cars. So in a certain sense, the residential area that I talked about is that we're paying for car storage. And you might have heard that people in New York often don't even use their car during the week. They move it from side to side. So whereas the people that don't own cars are supporting the people that do. But look what happened in Long Island City. This is a major capital project, and these are important projects as well as the smaller temporary projects, the middle range projects, and then you have to have your large scale capital projects. And it flipped it. So no parking, the whole entire area was for people to be active, to sit, to linger, to move, to walk. There's only so many of those you can do, but those are really, really important to show that you can do those things. Now, art, as somebody said, this DOT art was created in 2007 to show and to sort of claim space in a very visible way. The division was created in 2007, as I said. We put art on Jersey barriers for bicyclists and pedestrians, and then took over streets. It's a way of communicating and reclaiming space. And I thought this one, the next one, is particularly important because this is downtown Brooklyn that Jeffrey spoke about. And it's very clear sign that this space is for people. It's no longer for cars. It's to sit, to linger. It's vibrant, it's beautiful. And look how simple the seating is. Nothing fancy, right? Doesn't have to be fancy. And somebody talked about steps. So we've done, the DOT art program has painted a number of staircases to make it easier to walk up. You know, it's interesting, Michelangelo did this in the 1500s, where he would have you walk up and then he'd have a sculpture at the end of one flight of stairs before you turned onto the next flight of stairs. So this, in a way, is something that's happened through the centuries to encourage people to walk. So what happens after you reclaim the space, you take it back, you show people, the public, that you have taken the space back, and then you add a layer. You add the next layer of furniture on that street. And over the years, the Department of Transportation with other agencies has created a family of furniture attractive, to get to Jeff's point and other people's points, that it should be attractive to encourage people to use it, a family of furniture for the streets of New York City. Now, seating is really critical for the elderly, for people who have a hard time walking, et cetera. But Ignacio Cuccini did this for a business improvement district, but it belies the complexity of creating a seat in the public realm. It's beautiful. Water can go through it so it doesn't puddle. He raised the handles so the elderly could stand up. It was placed near senior centers and hospitals at first. And now there are over 2,100 benches installed and maintained by the Department of Transportation in New York City. Now, everybody doesn't want to sit down. Sometimes it's harder to get up when a bus is coming. So we've also created something called leaning seats that people could lean against. If you start noticing, people often lean against something when they're waiting for a bus, if there's something to lean on. So we created something to lean on. Now, the other thing that we did was, as everybody knows, the city bike. That started in 2013. I do want to point out that this is a city bike station that has docks for 27 bikes. Compare that to the number of cars adjacent to it. Now, over 100,000 rides a day are taken on city bike on good days. And I don't know how many thousands. There's a huge expansion, huge number of bikes. It's a third transportational alternative to the subway, to buses, to rail. And now we have city bike. It's what they talk about is the first mile or first mile, last mile, like you can ride to the subway station. So city bike is often at subway stations. So they're all connected to each other. It's really quite beautiful. I love city bike. I use city bike. And then of course you have to have bikes to bike parking. There are now about 28,000 of these. We did an international competition in 2007, 2008. Ironically, somebody from Norway won the competition, and we've put these in. They're attractive, they're recognizable. And then because we were changing parking meters to what we call muni meters, we transformed parking meters to bike parking. And I think the indoor bike parking and outdoor bike parking, you can hear how many more outdoor bike racks there can be. So those are things that have to work together and create spaces and places for people to park their bike. We then created a whole family of wayfinding signs. I won't go into detail. I could probably do a lecture just on the wayfinding system. It's integrated and horizontally and vertically integrated with this signage in the subway system. These maps are heads-up maps that look in the direction people are going. There are probably 500 or 600 of these. These maps were also placed on all the city bike stations, so it was duplicated, so people could be encouraged to walk. And the important part of this, and we learned from London, is there is a 5-minute walking cycle so that people know where to go and the directions. Here it is on the street. And well, people say you don't need these anymore because everybody has a phone. Number one, not everybody has a phone. And number two, people really like to just stand there and look at the map and orient themselves with the map. And in the future, Jeffrey spoke about the elevated infrastructure. There are about 700 miles of elevated infrastructure. We did a temporary piece on the left, and now we're working on a permanent installation, prototype design to add lighting and seating under elevated infrastructure. That's an important thing, to create spaces where there's one's basically parking under elevated places. And of course, I have to include art always. These are temporary exhibit spaces. We have 10. They're easy to put on the exhibit. It's easy to take off and change these exhibits. These are on wide streets in 2 or 3 different areas in the city at a time. And of course, there's murals. Murals always help to have people enjoy walking around the city. I think the more murals, the better. And they're really high level. We work with Dumbo, again, a business improvement district, to develop these murals. So I think another important lesson is a lot of things that Art does and what we do and other people have talked about is with local groups, local business improvement districts, and community groups that want to improve their areas. Now, what's the third level? The third level, once you've taken back the space, once you've done things and put furniture on that space, is to program activities. And those activities can be planned, they can be allowed, and they can be spontaneous. So again, downtown Brooklyn is a great example of planned activities. They have dance parties. It's very active. People are jumping up and down and really, even in the heat, having a great time. And so it's community building and active and activities in these public spaces that were created for this purpose and taken back. This area had more cars and streets and buses. And so now it's been taken over by a plaza. Another thing that we do, and is very beloved in New York City, 100,000 people, over 100,000 people to summer streets. It happens on 3 Saturdays in August from 9 to 1. And I do want to say we did not invent this. Again, we deal with other, we learn from other cities. We've learned from Norway. We've learned from Bogota in this case that started Ciclovia in 1974. And Ciclovia opened up streets for people to walk, to bike, to have activities. And I'm happy to say we're back this year. There'll be 3 Saturdays in August, and it's expanding to East Harlem. So it was from Brooklyn Bridge up to Central Park, and now it's going to be 8 miles up to East Harlem. It's a fantastic thing. And again, it allows people to experience the streets, but also see what is possible to happen on the streets. Now, this is really interesting. It doesn't have to be a big event. It could be permitted. These people took over the street. Again, it was an open street that started during COVID. It will continue. Very, very inexpensive. It's planned because it's not planned in the big way, but permitted. Someone's doing yoga. Kids are all over the street. And it's a way of young people also understanding what they can do on the street. And now it's not changing. Okay, I'm not sure why this is not changing. Hold on. Let me see if I can get this. Sorry about that. Not sure why this is not changing.
Is that the final one or?
It's 2 more.
Okay. It's
2 more is done, and then I'm done. Anyway, I'm going to keep going down, but I had another one that showed, but I'm not sure. This is planned, but I can't guarantee you will make a move like this if you create spaces for activities like the participants in this yoga class, but or that you'll look buff like these guys who were spontaneous in Times Square. But I can guarantee that you will enjoy it. I do want to end with a quick story. I was at a party in the Upper West Side on a Monday night. This is important. It was a Monday night. I left the party. I said, I'm going to take a city bike home. I got a city bike station very quickly. I rode down the Hudson River Greenway that had been a highway at one point. Now it was a greenway where I could ride all the way down. I decided, I thought I'd leave the bike at Brooklyn Bridge, decided to, in fact, change the bike. I rode over the Brooklyn Bridge on the bike lane that they took away from 1 car lane. And then when I got to Brooklyn, I decided to change into my own clunker. And I said, let me see what's going on Brooklyn Bridge Park, which is down by the river. Again, this was created out of a port where that was not in use anymore. And this is what I saw down at Brooklyn Bridge Park. We're at 10 o'clock at night. I saw people strolling, I saw people walking, and I saw people being active. And I thought to myself, I thought from start to finish on this ride, over an hour, this is what an active city looks like and feels like through the whole ride. So I want to thank you. Lessons learned, and I want to close with lessons learned in New York City. Be flexible. Test temporary projects and change if warranted. Be creative and be strong. Know that this is a long game. There will be resistance. Be committed. Sometimes small interventions can be as game-changing as large moves. You're not alone. The transition is essential for people's and the Earth's health. It is happening in many other cities. Look to them for inspiration, and please have fun. Thank you very much.
Wow, thank you so much, Wendy. And very inspiring. Many of the picture of how the creativity can encourage people, even the small like kids, to joining the public and you called it the reclaim the public space. It's very interesting. Thank you so much. We have some more like 10-15 minutes for the final session. I note down many of the key message for this presentation. All of these we will share again. You can see it backward after this as the video, and also we will hang this link. We can send you by email as well to send circulate to your network. There's maybe we have some few more minutes for some 2 or 3 questions from people from the Facebook Live. I think this is a key question. Maybe all of you can share your opinion as well. New York City is diversity of people and groups. How can you engage with the range of people, and how can you make consensus among different groups of people? Anyone can share your experience, maybe.
I think I'll go first because of DOT, the Department of Transportation, and leave it to other people. But the short answer is one meeting at a time. Whenever DOT does things, we have 5 borough commissioners, 1 in each of the 5 boroughs for New York City. They are out at community board meetings whenever we do a new streetscape project or even put in a new city bike station. These people are out in the community. The other thing is important, that's communication. There's a very active website. And I did want to say that there are a lot of brochures and a lot of information on NYC DOT's website.
I'll add that, for example, in our Housing for Health project, and also when I was working in New York, the health department team not only partnered with, I think, our different city departments and with the private sector, but we also actually had public and citizen engagement workshops where we would bring people to our workshops, different age groups. Sometimes we would work with the schools, like high schools. Other times we would work with, for example, we worked with the Architecture Foundation because they did workshops on weekends with families, but we also did adult workshops with the public libraries. And what we would do is bring people so that they could learn about how their city environments or town environments are affecting their health and their family's health. And they could also share ideas of what they wanted to see that could improve health and well-being and quality of life in their neighborhoods. And then we would incorporate those ideas into discussions of what we might do as a city to help improve their neighborhoods as well.
Thank you so much. Is there any more comments or more experience to share about? I think it's more about the process, this question. Okay.
Maybe just to quickly add that, I think inevitably when we would have a public meeting at city planning, people would ask about transportation issues, because you're the city, right? You represent the city. So, and we kind of learned sort of late in my time there is that we should have every discipline represented at these community meetings, and particularly when we're talking about neighborhoods, have somebody from transportation there, have somebody from health there, so that, people can ask, there's somebody there to answer the questions in a more informed way, rather than saying, we'll get back to you, which is never a good answer.
When I was in the mayor's office and we were developing Plan YC and a lot of the policies that grew out of it, we had a lot of expert groups that we brought together to advise on the development of more refined policies. And, people talk a lot about bringing stakeholders together as if it's a box that you're checking. But for us, it was really very much about not knowing enough. And we really needed to turn to all these people to explain a lot of the intricacies. And so I think if you really bring people in, because you need their help to solve problems. It really creates better solutions, and it creates a community of really engaged participants. So that's how it worked for us.
Right. Yes. Thank you so much. Maybe one or two more comments, please. Mr. Ruang, New York City has a multicultural and high population. Have a space. Do they have enough space for relax or green area?
One thing, I mean, Jeffrey, you can maybe speak to this. Plan YC that came with Mayor Bloomberg was to create green space within walking distance of every neighborhood. Am I right about that, Jeffrey? Do you want to?
Yeah. And I think, we often hear this from New York City residents that there's no more room to grow, but then when you actually get on the ground and start walking, yes, maybe Manhattan is kind of, it's getting there. But, when you look at most of the boroughs, there's actually quite a lot of land that's just not being well utilized. For example, what Wendy and her team led, the sort of under the elevator, looking at these spaces underneath infrastructure that today are just they're fenced off, they're being used for storage, and there's miles of space there that if you design it properly, open it up, suddenly you have, greenways running through just about every neighborhood. So I think we just have to be smarter about how we use the land that we have.
Not only that, but there are the rooftops. And the rooftops are actually equal in area to an entire borough. And the rooftops are generally underutilized, but they could be gardens, places for activity. But my sort of favorite technique that came out of Plan YC, one of the promises of Plan YC was that every neighborhood would have a park within a 5-minute walk. And that wasn't possible absolutely everywhere. And somebody came up with the idea of using the fourth dimension of time in schoolyards. So schoolyards were not used for the schools 24/7. So you could open them up for the community during the other time and make them playgrounds for the community. So it was called Schoolyards to Playgrounds. And I thought it was just a brilliant strategy for using spaces more of the time.
The parks and green spaces within walking distance of every New York City resident as part of Plan YC. One of the other areas that we used was, as Lori said, there's the schoolyards. Then there was also the streets, right? So Wendy talked about, and so did Jeff, about transforming underutilized spaces into, for example, pedestrian plazas. And so there would be these spaces that count as pocket parks, and that become spaces that you can walk to see your neighbor, to socially gather. And I remember at one of our early Fit City conferences in New York, we actually had a private sector developer. And one of the comments he made, I think, has stuck with me, which is, a really important piece, if you're going to have density, is to have spaces of respite, spaces where you can get away from that density. And so if you're living in a small condo or apartment building, it's more important than ever that you have public space where you can go to that are spaces for rest, spaces for physical activity, spaces for recreation. And so this combination of density, having enough people so you could have lots of services around them and house them, but also spaces where they can go to that are not isolating, that are places where they can meet other people, spaces where they can get some exercise, spaces where they can get some mental respite and mental rest as well, are a really important combination.
Okay, thank you. And I think it's more and more that people get familiar with the word like the pocket park, and also some walkable, reachable in the 5 minutes walk, and also some allotment can not only go for green area, but also vegetable as well. Okay, it's like a city farming, something like that. Okay, one last note from the Facebook comments. They asking about, because in some country, they have the very good intention design, like for the health, such as the bike lane separate from the road. But in the real world, some people break the rule and use them for example, for different speed, like a motorbike. And how can we set awareness and how we can make the right thing with the right way when we already decided?
I think you showed a picture like that as well of the motorcycles going on the sidewalk. And I can tell you in New York City, and that's when that image that I showed of like holding back of the problems, it's not all, we showed a lot of wonderful pictures, but it's complicated, it's messy, the transition. And we are having that issue of not only cyclists going through red lights, not respecting pedestrians, but more the people on electric bikes and the motorized bikes that are going on sometimes the sidewalks, but certainly in the bike lanes and not respecting. So there's a problem. I think that gets to a third arm, which is enforcement, which is an issue. I'm just gonna, I can't say anything that we have a solution yet. But I think that's where advocacy groups, all along advocacy groups, you said it in the beginning, it's the government, it is scholarship like you're doing, and it is advocacy, government working in partnership, and local people that have to try to deal with that issue. It is an issue.
Thank you.
I think there's design elements too, right? For example, if it's very easy to weave from a motorbike from the road space onto either the bicycle lane or into the multi-use path or the sidewalk, then you're more likely to have it. So I think as important as enforcement is, as Wendy is saying, design elements. So for example, if there are barriers that make that more difficult, or elevations that make it more difficult, then it's probably going to be less likely to happen as well. So I think there's design elements combined with the enforcement piece related to those infrastructures.
Okay.
Can I ask a
Yeah,
question?
yes, Dr. Anand, please.
Okay. Thank you very much for your talks. It seems to me that as a doctor, we have a lot of more things to do with the architects or the designers. I think what you have done so far and theoretically is very correct, and I think that it would help. But may I ask whether we have a solid evidence of benefits, like we have some kind of measurement in improving in some kind of health indicators that we can convince people? The theoretically it very sound, but do we need to have that kind of data?
Oh yes. So Anand, when I was with the health department in New York City, we collected data. So for example, every year, over 10,000 New Yorkers would be surveyed, and we would actually oversample in areas that had high health needs. Often those areas are also the poorer areas of the city. And what we found, I'll tell you about the following. So for example, we actually saw life expectancies improve during the Bloomberg years. And when our epidemiology group took a look at what was the cause of that, one of the major reasons was improvements to chronic disease outcomes that were being seen in the city over that decade of work. Things like physical activity. So, prior to the decade prior to us doing this sort of work, physical inactivity. So, having no physical activity in the last 30 days was flat. And then as we did this work, we saw that having no physical activity at all in the last 30 days declined. And so we know people became less sedentary and more active during that time. We actually measured every child in public school in every grade. Their heights and weights are taken to do obesity surveillance in childhood obesity surveillance. And we found that, during the Bloomberg administration, as well as we were doing this work, childhood obesity rates actually, the trends were going up, and we saw a reversal in those trends during that period of time. Yeah, so we have hard health outcomes that were measured. And so I think you bring up a really important point, though, of you need to measure these different outcomes, whether it's retail sales or traffic congestion or bicycle use or transit use or health outcomes like childhood obesity trends, life expectancies. And, to measure those different outcomes also takes different expertise. And that's where the partnership that Jeff was talking about comes together as well.
And certainly there have been fewer fatalities and serious injuries to bicycles and pedestrians since these have gone into space. Karen is absolutely right about collaboration. DOT keeps a lot of data on serious injuries and fatalities, as well as other data on usage, a lot of information on use.
Okay, this is very lively and fruitful conversation. Actually, there are many more questions for me as well. Like, for example, in the indoor quality, if we need to tell the owner of the building to provide some kind of facility that support their activities, how do we convince them, like number or costs and benefits? Do they see it as the waste or investment? So there are more things that we need to learn and to need some find more case studies as well. I'm so sorry that today we don't have enough time. Rory, do you turn on your microphone?
Well, just a quick point in that regard. Building owners often won't pay for sustainability measures, or they're resistant to do it unless they show a payback. But they'll almost always pay for things that make their spaces nicer, right? Because that's going to add to the value. And I really can't emphasize enough that so many of these health-related things, you would think that they're, sort of like some kind of pill you have to swallow because it's about health. It's not. By and large, it makes these spaces, interior and in the public right of way, more pleasant, more interesting, et cetera. And so I think, maybe looking at that, because that's maybe the path of least resistance for a building owner. It's going to make your building more fun to be in and more beautiful.
And economically too, I would say, when we improve the public realm for walking, for cycling, for transit, as the transportation data in New York City has shown us, often retail sales in that area tend to spike, right? Because people stuck in traffic, like in that area, they're not going into your business. It's people who are walking around, for example, or biking and it's easy to stop, or getting off transit near your stop, that are going into your businesses. And then similarly, health issues can cost companies a ton of money in terms of, health benefits costs, medical costs, sickness absence costs. And so improving your working environment and your working building and your working site can actually, and your working neighborhood can actually have great economic benefits as well for businesses.
Yeah, I can see now. That's why I involved with this kind of question more than 10 years, because I work with the accessible facility for disabled people. I would keep the question, how many disabled people will come to our building, how that costs for adding accessible facility. And that's why we need to work closely with the healthcare people or doctor or people who can provide them economic return as well, if we provide this kind of thing rather than to invest for the treatment or cure. This is a kind of a prevention approach. Okay, so I'm sorry if I cannot put all questions or comments to you, but I think we have a lot of thing to learn, because you know this year Bangkok, Thailand is the first time in over the last 8 years that we have people elected governor. So I think this is very good timing that we start thinking about the role of architects, planner, designer, artists, and particular for healthcare people to work together, you know, to make our city better living for all. Thank you so much, everyone, for today. Very special seminar, and I hope that for the next step we can find one case study to work together, not only sharing our discussion. Okay, so thank you, everyone. If you don't have anything more, I would like to close, and thank you for the audience as well, particular in Thailand. Now is 11 o'clock in almost the midnight time. Thank you so much. Until next time. Bye bye. Have a good morning, good day, good evening. Bye bye. Good night.
Thank you.
Goodbye.
Thank you. Bye.
Bye-bye. Thank you all.
Bye-bye, everybody.